Good morning, everyone, and welcome to Executive Policy Committee for Tuesday, July the 8th, 2025. I'm Scott Gillingham, Mayor, joined today by Councillors Santos, Lukes, Duncan, Eadie, and Brawadi. Our interim CAO, Mr. Sherwood Armbruster, members of our clerks team, and members of our administration as well. We're gathered on Treaty 1 territory, traditional homeland of the Red River Métis. Our drinking water comes from Shoal Lake 40 in Treaty 3 territory. I'll entertain a motion to receive the minutes of the previous minute. Thank you, Councillor Duncan. All in favor? Aye. Opposed? Carried. Thank you. We have a number of delegations this morning, and so do we need to suspend the rules for? Okay. Councillor Duncan moves suspension of the rules to receive the other reports. All in favor? Aye. Aye. Opposed? Carried. All right.
Okay. And then if we can just get suspension of the rules for Councillor Gilroy to appear in delegation with respect to item 12.
Councillor Duncan suspends rules to hear Councillor Gilroy. All in favor? Aye. Aye. Opposed? Carried. Thank you. Councillor Gilroy, good morning. Welcome. 5 minutes.
Thank you very much. I know you have a large delegation today, so I'll try to be brief. So I came in to speak to this motion because it's not just about policy. It's item number 12, just for everyone to be aware of. It's about people. It's about how we as a city respond when families are grieving, when communities are hurting, and when justice calls for us to act. We are here because women, Morgan Harris, Mercedes Myron, Rebecca Coitus, and of course, who we call Buffalo Women, their lives matter. Like myself, these women were daughters, mothers, sisters, and they were loved. And they were taken. Their families have been left in limbo, and we must do better. And the truth is, this isn't new. Sadly, across North America, landfills are far too often become final resting place for Indigenous women, gender diverse people, and that's why the response, or lack of one, was so painful, because it felt like history was repeating itself. The numbers make it clear. Indigenous women make up more than 5% of the Canadian female population, but account for 24% of the female homicide victims. They're 6 times more likely to be murdered than non-Indigenous women. And when we look at gender diverse and two-spirited people, the rates of violence and disappearance are even higher. These aren't statistics, these are lives. These are families that were torn apart. And yes, we need action. I want us to have a plan moving forward. Let's sit down with other levels of government, Indigenous leaders, not in crisis mode, not in a budget battle, but with clear intent and compassion. We can't let this become a public fight about costs when people are devastated and grieving. That's not leadership, that's avoidance. And we also need to look at systems themselves. Are we following best practice for landfill operations? Are we designing and managing them in a way that allows access when tragedy does strike? Because it's hard as it is to say, we have to be ready. We have to build a system that can support justice. The motion puts us on a path. It says, we see the pain, we've heard the calls for justice, and we are choosing to act, not just in words, but in real steps. I believe issues like this is a part of reconciliation efforts that we have to sign, that we've all signed on to. We can take a tragedy and learn from it and be prepared for next time, and let the women's families know that in death, there was systematic change, although there was a traumatic death. And I just wanted to highlight for you that there are ways we can do things that actually make it more affordable and easier to search landfills. Toronto and Vancouver have geographic information systems. This reduces time dramatically for searches. Calgary has remote sensing to scan sites without extensive digging. And in Melbourne, they have protocols in place between police, environmental experts, and Indigenous communities. So these are things that we could be a leader on in terms of bringing together the governments that are needed to deal with this matter, and making sure that what had happened in the past, this doesn't become a budgetary issue, that it just becomes about bringing peace to families. So that's what I have to say. Open to any questions if you have any.
Thank you very much, Councillor. I'm just assuming you are aware that Buffalo Woman has been identified at the end of March, was identified as Ashley Shingoose, and whose remains are believed to be at Brady Road. At that time, the Premier committed to doing a search, and so analysis is being done right now. We're related to Brady Road, and, you know, I'm hoping that we, you know, there's more information that can be provided in the coming weeks or months once some of that analysis is being done. The City of Winnipeg staff is working with the provincial staff as well, the provincial staff that oversaw the Prairie Green landfill search. So our staff is working with provincial staff related to Brady Road. So, you know, news, hopefully there's something to, an update and something to share in the coming weeks or certainly months ahead. So, so just as an FYI on that.
Perfect. And then, thank you for that, because I wasn't aware of that. And if maybe through Councillor Edie, through you, Mr. Mayor, if we could be looking at our own landfill practices, because there are lots of different landfills that are doing really great things. I've reported on some of them here today that we could be learning from, and some of them are very cost effective, right? So, so just through you, Mr. Mayor, to Councillor Edie.
Yeah, appreciate that. So I would say, just maybe, I hate to do an are you aware, but I'll do an are you aware. Are you aware that if this is received as information today, it's in my mind, it's because I would like to see the search be done, Brady, and then at that time, if there's any lessons to be learned related to what we have done related to Brady, that would be the time to do it, because part of this is police matter as well, so.
Yeah, I would hope though, and I would expect that this would take time. I would hope we would take this and come back with a plan so we know, like, how we reacted the first time. It just, I don't ever want to see that again. It was not right. And so there has to be some kind of system in place, overall system. That would be other levels of government. I'm being realistic here. You know, the cost came from the provincial and the federal government. There are things that we can be doing in our own landfill. So I would hope that we would take this and not just receive it as information, but bring back the data that you are learning from and have an extensive report that really asks what I'm saying, so that next time you know, we have a protocol in place.
Okay.
So that would be my hope.
Okay. Thank you very much. Thank you for your time today.
Have a good day.
Thank you. You too.
Our next delegation is Laura Messiman, Executive Director of General Council of Winnipeg Community Centres, to be heard in support of report number 13. And Laura is joining us in person.
Good morning, Laura. Welcome.
Good morning, Mr. Mayor. Thank you, and councillors. Good to see you this morning. Thanks so much for having me. I will keep my comments brief, as I know that you have a busy morning. So again, thank you so much on this beautiful July morning, nice and sunny. I see that you have a busy schedule. As I mentioned, the recreation strategy approved by Council in 2022 called for an update to Plan 2025, which was a long-range plan for community centres focused primarily on facilities. I was a community center volunteer back when Plan 2025 was received as information at EPC in 2009. I participated in many workshops and multiple meetings back then, and our team was disappointed when the report was only received as information. So the update before you is called Plan 2025, and it's a result of almost 2 years of engagement and collaboration with Winnipeg's community center volunteers, our team at General Council, and the City of Winnipeg staff, councillors, and other countless community organizations and residents. We leveraged various communication tools like surveys, workshops, and one-on-one meetings. Plan 2045 provides a roadmap, if you will, providing strategies and actions to help ensure our community center model is inclusive, sustainable, and responsive to residents that we serve, and well into the future. We focused on people, programs, and places. The intent is to provide direction over the next 20 years, much like Plan 2025 was intended, but we recognize that new opportunities and challenges will arise over time, so we built in review opportunities approximately every 5 years to ensure that this is truly a living document. Feedback we have received since it was placed on the agenda for today, already emails to my office. This is fantastic. This report truly highlights the strains we are facing along with solutions. I sincerely hope EPC reviews in detail and that the Council adopts the plan. That was from the President of Deer Lodge. Also, from a resident, I'm glad to see that there are funding changes coming to community centers. I'd really like to see equity in programming for all ages and abilities. We put in a lot of time and effort, says one volunteer. I'm glad to see the report is going to EPC. This is a positive move for community centers. I hope it brings about more attention to the fact that community centers like ours rely heavily on volunteers and free hours from our residents. I'm personally proud of the work that's been done and has gone into this report, and I want to acknowledge all the volunteers and staff who participated in this action plan. I also want to acknowledge the folks over at HTFC Planning and Design, a local company, MNP, and Robinson Consulting for their incredible guidance and assistance through this process. And more importantly, I want to acknowledge over 8,200 volunteers at 63 community centers. There are 81 locations and 130 outdoor rinks and countless other amenities that community centers assist in maintaining, like soccer fields, basketball courts, pickleball, and so much more. Our community centers complement Winnipeg's recreation facilities and services, and we are essential to achieving a high quality of life for our residents. My hope today is that EPC will adopt this report and that it will be approved at council. And I really appreciate your consideration.
Thank you very much. I just want to express my appreciation to you, Laura, for you've done a lot of heavy lifting, you and your board and your volunteers. So thank you. It's been a long journey. I want to recognize our staff as well in Community Services Department, as you said, the consultants and all the volunteers. It is remarkable. You know, if you add up those volunteers, then if you could estimate each of their hours that they put in, you know, we have people all across our city work full-time jobs, or you know, and their parents, and then on top of that, you know, when their day is done of their other house duties or work duties, they pick up the phone. They go down to the community center, and they're doing something on behalf of the community center to provide programming and making sure that, you know, kids and seniors and others have access to good programming. So kudos to all of our volunteers who really make this city work across all of our community centers. So thank you. Any questions at all? Councillor Lukes.
Thank you. Thanks, Laura, for all that you do. You've done amazing work, and you've helped out the community centers that I'm very familiar with. So I guess my question is, and you may not know this off the top of your head, and I'll get the exact numbers for when we debate it later. What is the, how many buildings do we have under the community center umbrella that operate under the community center umbrella? Do you know?
Yeah, we have 81 buildings that operate under the community center umbrella. So there's 63 community centers, but 81 buildings. So I'll give you an example. Central Corden Community Center has 3 buildings that they operate, but that's considered one community center.
Right. And what is the deficit? Like, what is the assets? The
Infrastructure deficit?
Deficit.
The last time it was estimated at $273 million annually, and right now there's $0 budgeted towards capital for infrastructure.
So when I think of some of the absolute successes of amalgamation, I think of the one on St. Mary's that we went and toured. St. Mary's, I think it was.
Yeah, you're talking about Norbury Glenlee, great community center.
Great, right? Great. And then I think out in Councillor Barati's area, there was a new one built because, or added on to.
Bronx Park, you're talking about
Right.
Bronx Park?
Bronx
Yeah.
Park. So, again, that was an amalgamation, right? And a newer facility. So what, like, I just don't understand if we've got 81 buildings and this $273 million annual infrastructure deficit, why the report didn't make recommendations to council. I believe the other ones came about, I wasn't here and I wasn't focused on community centers, but at that time, but it was because council put in large amounts of money, they had set up a fund to say, hey, if you amalgamate, you're going to get this and that, right? And that worked, right? Did that not work?
It did. At that time, there was $10 million for Plan B, but that was provided prior to Plan 2045 being received as information. So that money was already earmarked before Plan 2025.
Right.
Plan 2025 called for amalgamations, which is still underway today. So there is a community center that's working toward, 3 community centers, working towards amalgamation, and essentially they are amalgamated. They're just going through some challenges with CRA, if I recall. There's some challenges with one of them being a charity and the other 2 are not. So they're just working through those details. There is another community center, 2 community centers that have been in conversation about amalgamation. So it's not that amalgamation is off the table, Councillor. That still exists. Plan 2025, this is intended as a build off of Plan 2025. So amalgamation is still part of the conversation. And there were some other amalgamations, and we know of a couple of community centers that have other buildings that are now at the point where they're saying, it doesn't make sense for us as a board to continue to operate that particular building. So while we don't see the specific amalgamations in this report, that's really driven by the community center, and it's driven by grassroots. And I can say that many community centers feel very personal about their center and very focused on theirs only, so convincing people to amalgamate does take time.
Right, but I don't recall seeing in the report a recommendation to council to have a $10 million fund or.
There is a recommendation for that, but we didn't come to this table today asking you for $10 million because we understand the challenges that the city is facing today. We understand the $273 million infrastructure deficit and $0 added to it. So our intent over the next 18 months till 2027 is when we've indicated that we would come back and report. We're going to do an assessment of all of the community centers. We're looking at governance, financials, programming, and facilities, and not a deep dive with facilities, but leveraging the report that comes from the Municipal Accommodations Department and looking at where the infrastructure, where the deficits are in terms of just the regular repairs that they have to do. I'm talking about serious repairs that are the city's responsibility under the UFF.
Right.
And so that is the plan over the next year and a bit. And the Community Services Department, Cindy and Kelly, have committed to working with General Counsel so that we can get that work done and then come back to you with clear, defined data of what we expect and where we want to see this community center model go.
So I guess the other question I have is, in this request for funding for the 250, that's the wage subsidy.
Yes.
And then you want 35,000 for legal advice. So I don't know who should be doing this, but it's just, to me, it's astounding it isn't done. So I'll take an example. We had a really deep dive by the city economist on high poverty areas in the city of Winnipeg, okay?
Yes, I'm familiar with that.
So we had this information, and that came about because many of us felt there were other high poverty areas other than just downtown. Downtown has the huge amount.
Yep.
The second highest poverty area is in South Winnipeg, which
Yep.
people were very
Yep.
surprised about. So when I reach out to community services, or when the volunteers at the community center, they don't have this sort of information. They're just doing their little programming, whatever program I guess they want to run. But there's no knowledge sharing from the city, and I would think the city should know this information on what is and isn't lacking to help guide these community centers on what programming they should and shouldn't be offering. Like, why would we be offering indoor dog training in a high poverty area? You know, like there's no, where is this information coming from? Like, there is no information out there. We're having to find it ourselves. There's no information. The community services doesn't have this information on what programs are already existing. Like, what programs are out there? What programs are needed? What are the demographics? What are all of these data points that a community center could use to ensure they're delivering the right type of programming? Like, where's that going to come from? Otherwise they're just oblivious, working in their little empires.
I'm not sure what your question
I guess,
is.
where do you envision this data coming from?
Okay. Fair enough. So we're aware of the poverty data that's available. There's also demographic data that's available through community services. So this question came up not long ago, and we were able to access that. We've worked closely with community services. They provided this information. General Council collects on twice a year the programming information from community centers, and we report that on our website so that residents have access to see what's available, and we also encourage community centers to do that. We've stepped up to the plate. I've hired a communications coordinator that's helped us build out our social media platforms and our communications to residents, because one of the things that we heard in the survey that was done was that they didn't understand the function of community centers and didn't understand what programming was. So if you live in the area, maybe you follow their social media, but maybe you only do that because your kids are in soccer, but you might not know that there are other programs. So that is the intention of this report. We uncovered that. That is a challenge. And so part of our goal over the next year and a bit is to do these accountability assessments. Again, it'll look at programming and governance, and it will look at their financials, and it will look at the facilities. And our goal is to then have that data so that we can support the community centers. It's also why we've led with the request for programming wage subsidy, because the community centers that can't afford staff need staff to help them support that program need. And that's primarily in the inner city, yes. Down Pembina, there's definitely some pockets of poverty, and we've discussed that with several of those community centers in those areas. I don't have all the answers today, Councillor, but we are working towards that. And this report is that roadmap, if you will, to guide us. I see this as a guidepost, because before we were just reactive. This is intended to be proactive. So I acknowledge all of those challenges, absolutely. There are bits of information and bits of data points everywhere. Let's get them pulled together so that we clearly understand what each community center is facing.
Thank you. Thank you. Any other questions? Okay, thank you very much. Appreciate your time.
Thank you all. Have a great day.
Okay, the next 8 delegations are to be heard in support of item 5 of the report of the Standing Policy Committee on Water, Waste and Environment. And first up is Marg Friesen, joining us in person. And following Marg will be Barry Malowanchuk and Joyce Fox. And just a reminder for all delegations, you have a maximum of 5 minutes today.
Yes, I may need some help here. Help on the way. Is this mic on? Oh, okay. Do I have control over the slides or do you? You'll have control of the slides. And I push. Great, thank you very much. Good morning.
Good morning. Welcome.
Mayor
Go ahead.
Gillingham and councillors. My name is Margaret Friesen. I'm here today to speak in favor of recommendation for the opt-out program with some amendments. I am representing a number of people with the Environmental Health Association of Manitoba. I have a Master's of Science degree and have over 30 years of experience as a research biologist. And post-retirement, I've been investigating this intensively. We are a nonprofit, non-governmental, nonpartisan organization run entirely by volunteers and funded by donations. I want to start with the fact sheet, so-called, that the city included in its package to say that safe meters were smart and safe. They're not, they do have health risks. There's a statement that says there are no health risks from exposure to radio frequency EMF from smart meters. There have been no long-term studies conducted on adverse effects, and absence of proof is not proof of safety. The World Health Organization studied this a couple of decades, well, 15 years ago, and, oh, actually, it's more than that. And they did include smart meters in their literature review. And what they found was, and that was nearly 1,000 publications, by the way, and what they found was that radio frequency radiation, including smart meters, is a possible human carcinogen. And that was based mostly on studies by humans. They did not have the animal studies at the time. Since then, and just April 2025, a major review by the World Health Organization, or sponsored by the World Health Organization, found high certainty of evidence linking exposure to radio frequency fields and cancer in animals. So there was that supporting study. One of the co-authors is a Health Canada scientist. Medical doctors and scientists independent of industry influence are now calling for it to be a known human carcinogen. And it's on the IARC's list for a high priority for reevaluation. Even the telecommunications companies recognize this as a risk, and this is a little extract from the 2024 report. So expose us to potential litigation, and that's under regulation risks, radio frequency emissions. The other fact sheet has to do with Safety Code 6. The only established effect that Safety Code 6 has for these frequencies are overheating. And I'm quoting from a Health Canada report, Safety Code 6. You just have to go to table 5. This is from Safety Code 6. And you can see for smart meter emissions, the exposure levels are 6 minutes. That's what the safety is being exposed on. If tissue is not overheated by 1 degree, they consider it safe for everybody indefinitely. So why is that? Well, they're not studying it by Health Canada. There's been $0 devoted to this study for smart meters, and another department is raking in billions by the licensing of radio frequency such as for smart meters. So this does not align with our Winnipeg policy alignment. So I think you're probably all familiar with the goals. So for proactive, long-term community beneficial outcomes, we need to protect the most vulnerable. A fulsome opt-out program would contribute to this goal. Also, the Winnipeg Poverty Reduction Strategy alignment. So it says to promote and maintain the welfare of all residents. This statement is incomplete. Lack of a fulsome opt-out program will limit the housing options for people at and below the poverty level, and possibly others as well. Safety Code 6 and the precautionary principle, which is basically better safe than sorry. So Health Canada's Safety Code 6 is not protective of health for people with severe electrosensitivity. You'll hear about more of that later. And exposure may have unintended serious health consequences. So this brings up the question of liability. Is risk of litigation assumed by committee members and city council, city council by denying people an opt-out program?
You're able to wrap up right away?
Yeah, opt-out program option to this smart meter project. And last but not least, whoops. So we request that you support this with a direction to the public service to present detailed plans to fulsome opt-out program and to make this available for public comment before the request for proposal to potential vendors is made, so we can ensure that we have the safest options according to people's needs. Let the technology serve the people, not the other way around.
Thank you. Thank you for your presentation. Appreciate that. Any questions at all? Okay, thank you. Thank you very much. And this presentation, I believe, is attached, right? It will be part of our submission, your submission today, so that will be available as a public record. Thank you so much.
Okay, our next delegation is Barry Malowanchuk, also to be heard with respect to the same item, and Barry is joining us via Zoom. Barry, if you want to go ahead and unmute yourself and turn on your camera, you have up to 5 minutes for your presentation.
Good morning.
Good morning, Mr. Mayor and councilors. Thank you very much for the opportunity to speak before you, and I will be brief. My name is Barry Malowanchuk. I'm a retired professional engineer, formerly with Manitoba Hydro for over 40 years, and I have over 60 years of wireless experience. I have extensive experience with radio frequency EMF safety issues. I guided Manitoba Hydro's RF EMF safety program, and I practice personal safety with amateur radio in the frequency range of 50 megahertz to 241 gigahertz, which covers all of the possible spectrum that this water meter system might cover. Oops. I have some comments on the opt-out program. From the diameter report, Health Canada website states there are no health risks to radio frequency EMF from smart meters. Margaret talked about this a little bit. Health Canada has not done long-term exposure and low-intensity exposure studies to determine the safety of radio frequency EMF. Previously, Health Canada said that smoking, vaping, asbestos, and UFI were all considered as safe. So, you know, there's your confidence factor in what they're doing with EMF exposure. My experience has shown that a small part of the population do have hypersensitivity to radio frequency EMF radiation. I know quite often, you know, there's jokes made about that, but it is a real phenomenon, and a lot of the people will talk about that today. The City of Winnipeg must accommodate people with this condition by providing a fulsome opt-out program. The City of Winnipeg should add the options in the request for proposal that it's going to be putting out, suggesting what it would like to offer to householders who want to opt out or who need to opt out in this case. So, from the diameter report, it mentioned transmitter powers that were possible for some of the transmitter units, and they were talking about 1 watt or 2 watts of power, and it said that this is, you know, low power and you know, much less than baby monitors and cell phones, and that is not true. This is not low power transmissions. Your cell phone is like 1/4 of a watt at maximum. So safety cannot be assured at these power levels. As a minimum, even if there is no opt-out program, there needs to be some consideration for sensitive occupants, perhaps by you know, cutting the frequency of transmissions down from once a day to once a week, and use a minimum of transmitter power. I don't know if the intelligence is in the radio equipment. It may be like it is with a cell phone where it turns the power down, but in the diameter report in section 3.8.2, we talked about transmitter location. Diameter recommended fixed radio network transmitters be located on the outside of the premises. And the financial model will assume that the radio transmitters will be located outside the premises. Now, this would help with the people that are sensitive to these emissions. So is this still the case? Is it in the financial model? I don't know. So my final comments, I support the recommendation from the Water, Waste and Environmental Standing Committee with the following modifications. There should be no cost to the consumer, to the customer. The option should be available when moving to a new residence. I mean, if someone moves that has this condition, and now I'm assuming they're not moving every 6 months, but you know, there maybe needs to be some proviso on that. But you know, if a person moves, you know, and they still have the condition, and it's a health issue, it's serious. There was a suggestion that a medical letter needs to be signed by a medical doctor registered only in Manitoba. No, that should be, that's such a specialized area. A lot of the doctors are outside of Manitoba, so it should be just general in Canada, wherever they are. So the city should add the options in the request for proposal so that it would suggest what it wants to offer to the people that are going to make proposals. So that's it. Thank you very much for the opportunity to talk to you.
Thank you very much, Barry. Councillor Edie and then Councillor Lukes.
So our public service went to great. They did a lot of research on this. Now I'm hearing you say that some of it's not true, but I want to ask you this question. You've worked with it for years. It's reported that the smart meter transmitter is able to send out that signal in a particular direction rather than, you know, like cell phone service. You got waves all over the place, right? Like, but with this, when it transmits, it can send it out in one direction. Is that true?
No, I would think not. If you were dealing with a very extensive, complicated radio network, you might customize antennas like that. But if you're going to have it, installed on a water meter in the basement, it doesn't know what direction to go. So it's going to have a general transmission in all directions. There may be even bounces off of other buildings that will complete the signals to the collection site.
Well, if it's bouncing, it lost a lot of its ill effects, though, hasn't it? When it's
But that's after it's left the building. So, the effects are on the people inside the building that might be close to the meter.
And the people are inside the building, right, sir?
Yes, well, you're putting the water meters in the homes, aren't you?
Another question is, do you have a problem with a digital smart meter being installed without the antenna being used, the transmission being used?
No, but the city would have to come and read the meter or get the customer to read the meter, which I think is a reasonable option. We do it now, and certainly as part of an opt-out program, why not? Have your digital meter and have the customer read the information.
Yeah, and they'll have to do it more often than once a year, right?
Yeah, well, that's part of the provisions that you can put in there to say.
You don't want the water service, right?
Yeah, that's right.
All right.
Okay, thank you very much. Councillor Lukes.
Thanks, Barry, for your presentation, as always. Now, what is occurring in other cities? Have you looked across Canada to see what other cities are doing in relation to smart meters?
Not exactly. I know, several of the other big cities have done something, but I haven't been following it closely. I know Toronto has had some problems, but I think that was equipment reliability. I don't know about the health issues. I think some of the other speakers today are from the other cities, and they'll speak to that.
Thank you.
And I do believe they have opt-out programs.
Okay, thank you very much. Appreciate your presentation today. Have a good day.
Thank you.
Okay, our next delegation is Joyce Fox, also joining us via Zoom with respect to the same item. Joyce, if you want to go ahead and unmute yourself and turn on your video, you have up to 5 minutes.
Good morning, welcome.
Good morning, Chair and Council members. I am speaking in support of the recommendation for item 5, opt-out program for the advanced metering system. I am speaking from my home in a large city in Ontario to share my experience with the Neptune wireless water meter rollout. I would like to spare vulnerable people in Winnipeg the ordeal I went through. In 2014, I received a clinical diagnosis of electromagnetic hypersensitivity, EHS, from the medical director of the Environmental Health Clinic at Women's College Hospital, who is also Associate Professor, University of Toronto, in the Department of Family and Community Medicine, and former chair of the Environmental Health Committee of the Ontario College of Family Physicians. I suffer severe disabling symptoms when exposed to radio frequency electromagnetic microwave radiation, RF EMR emitted by wireless devices at levels far below Safety Code 6 guidelines. Safety Code 6 is not protective of people with EHS, and I know many people across Canada, including people in Winnipeg, who are adversely affected by RF EMR. The Canadian Human Rights Medical Perspective on Environmental Sensitivities recognizes electromagnetic hypersensitivity. There are currently 12 hospitals in Ontario that have accommodation policies for people with EHS. My home has been professionally remediated to mitigate RF EMR. No radio frequency emitting devices or appliances are in my home. All connections, including phone, TV, and internet, are hardwired, and a smart hydrometer was changed out to a non-RF emitting meter that is read manually. In 2015, I received notice that my residential water meter was being replaced by a wireless water meter provided and installed by Neptune. Acceptance was compulsory or service would be withdrawn. Neptune installed the wireless water meter, and within days I suffered adverse cardiac and respiratory symptoms when in my basement and on the first floor of my home. Chest pain and respiratory distress continued to occur when I went into my basement where the wireless water meter was installed and resulted in a trip to the hospital emergency department. I couldn't get food from my freezer or do the laundry. I was also experiencing respiratory issues on the first floor of my home. This radio frequency actually is going through concrete walls and infrastructure. I informed the city my health was being severely compromised by the wireless water meter radio frequency emissions, and the city returned my original mechanical water meter, and I had no further adverse health incidents and could enjoy and work in my basement and first floor again. The water meter is read manually each payment cycle at no charge to me. In 2021, the city notified me that Neptune would install a new water meter and run a wire to an antenna on my property outside my home. My property is very small, and anywhere Neptune may place the antenna would cause RF to enter my home and impede my accessibility and enjoyment of my property. I again refused their demand to change to a wireless water meter and contacted the Ontario Human Rights Legal Support Division and referred to the email correspondence with the city. The Ontario Human Rights Legal Support Division advised there is a violation of my human rights under the Ontario Human Rights Code, and I require accommodation to the disability that is suitable to my needs in terms of my disability, and without accommodation is considered a failure to accommodate. Further clarification could be found in the Ontario Human Rights Commission policy on ableism and discrimination based on disability. The city's stated intention to charge me a monthly fee to have the meter manually read was also addressed, and the charge would be deemed differential and unreasonable treatment by the Ontario Human Rights Commission. The city waived the charge. I encourage the committee to ask the staff to consult with vulnerable residents to develop a fulsome opt-out program. In closing, is risk of litigation assumed by committee members and city council by denying people an opt-out option to this wireless water meter project? Thank you.
Thank you very much, Ms. Fox, for your clear presentation. We appreciate that. Are there any questions at all? Okay, thank you so much. Appreciate it. Have a good day.
Thank you, you too.
Okay. Next up is Marie LeBlanc, appearing on the same item, also joining us via Zoom. Marie, if you want to go ahead and unmute yourself and turn on your video, you have up to 5 minutes.
Good morning. Welcome.
Thank you. Good morning, Mayor Gillingham and councillors. My name is Marie LeBlanc, and I'm in favor of item 5, the opt-out program for the advanced metering system. I'm originally from Manitoba, Because of my environmental sensitivities, my Winnipeg doctor referred me to a medical doctor in Alberta. During the time I was in Alberta, I lost my Manitoba provincial disability. It took 2 years to get on Alberta disability. During this time, I did a lot of going from place to place, trying to get away from triggers such as smart meters, desperately searching for a place to call home. When I could not find a place to live without getting sick, my Alberta doctor recommended I take my van to the US in the winter so I don't freeze to death in the Canadian cold. My van is where I live. I'd rather live in a van than in a place that makes me sick. This is not a glamorous lifestyle. I miss my family and friends in Manitoba. As a person with environmental sensitivities, including electromagnetic hypersensitivity, knowing what it is like to go from one province to another, I ask that you make an amendment to the current proposed opt-out program. Why are only doctors from Manitoba allowed to write a medical note to opt out? I can speak from personal lived experience that Manitoba doctors referred me out of province because they could not find the medical expertise in Manitoba. Limiting medical letters to Manitoba does an injustice to those who have had to go elsewhere for appropriate diagnosis and health care. Many with various illnesses, including environmental sensitivities, have a hard time obtaining medical letters, let alone having a doctor who will apply for the disability tax credit. This creates another hurdle for the sick person has to face. For those unable to obtain a medical letter, would you consider them on a case-by-case basis to opt out? Many cannot afford to see a doctor out of province due to finances, a long waiting list, they're very ill, and many other reasons. Some have already lost their primary residence and drained their financial resources. For those who had to go out of province to obtain a medical diagnosis, wouldn't you feel it is fair they are allowed to use the medical information from the out-of-province doctor? I'm having a hard time understanding why the patient who had to go out of province from a province who had no doctor in that expertise be forced to have a smart meter because their valid diagnosis is not valid in Manitoba in relation to the advanced metering system. Many people are not aware that wireless smart meters can impact their health. In the past, I stayed at a place that had a smart meter. I became very sick. Some of my symptoms included swelling in my abdomen, excruciating pain, and many issues with my cognitive function, head pain, and migraines, to name a few. It turned out that there was a smart meter on the other side of the wall where I had my head when I was sleeping. I got a tri-field EMF meter and measured the areas in the house. The meter scientifically verified the areas that I claimed as an issue. My family is in Manitoba, and if I were to move back and find a suitable home, it could be difficult for me to find a medical doctor to write a letter to get an opt-out. I would also not likely be able to afford the fees for the opt-out. I use this story as my story is the story of many in Manitoba, Canada, and the world. I would like to urge you to watch my short film, Multiple Chemical Sensitivity and Environmental Illness, Awareness and Acknowledgement, which was sent to you prior to this meeting. It has been screened at the Canadian Museum for Human Rights, MAWA, UCLA, and various film festivals. Many are suffering needlessly. Many live a life of isolation without supports, while some consider medical assistance in dying. Please do not add more barriers for those seeking low wireless radiation areas. Instead, expand the eligibility of an opt-out program to physicians across Canada, not just Manitoba, and make considerations for those who cannot obtain a medical note. It's an easy thing to do and would help so many. Mark Friesen from the Environmental Health Association of Manitoba can further explain why this is important. By approving this recommendation, you will prevent others from becoming homeless. Thank you.
Thank you very much for your presentation, Mrs. LeBlanc. Councillor Eadie.
Just a quick question. In reference to the doctors, so you were referred by a Manitoba medical doctor to a doctor in Alberta. Why couldn't your the referral doctor not accept what the doctor in Alberta says and be able to write a letter to confirm that you have sensitivity to radio waves?
Well, that doctor's no longer, he's retired.
No, but I'm
I was
just saying,
originally, pardon me?
I'm just saying, why couldn't you do that?
I could if I was in Manitoba. I was referred to Nova Scotia and then referred to Alberta because I couldn't get any treatment in Manitoba.
Okay. That's it.
Okay, good. Thank you very much. Okay, thank you for your presentation today. We do appreciate it.
Okay, you're welcome.
Okay, our next delegation is Sheena Symington, also joining us via Zoom with respect to the same item. Sheena, if you want to go ahead and, okay, I can see you. If you want to start, you have 5 minutes.
Good morning.
Thank you. Thanks very much for the opportunity to talk with you today. I too would like to support the recommendation for item number 5 for the opt-out program. I'm the director of the Electrosensitive Society, so I help support people like Marie. She did a very succinct documentation about a typical experience. There's a segment of the population where their brain or their heart doesn't work properly in the presence of wireless technology. It can also suppress their immune system. So different individuals have different symptoms. They can vary from chronic fatigue to chronic pain, cognitive disorders, heart palpitations, skin problems. There's a slew of symptoms that can accompany the person's response in the presence of wireless technology. She's right in that there aren't many doctors that are educated on this. There have been 2 medical conferences, one in 2019 and one in 2021, that have continued medical education. I presented at the 2021. We've also presented to the National Council on Disability in the United States about their health equity framework. So really being able to have equal health opportunities for people with these environmental sensitivities. Since 2021, I've had 12 hospitals throughout Canada accommodate people by eliminating their electromagnetic exposure, turning off their wireless signals and containing them. So again, Barry was talking about the radio frequency bouncing off of things, particularly if there's a source inside and there's anything metallic, it bounces around and can increase exposure for people within those buildings. I offer a weekly support group. I have dozens of people that join me each week, and I volunteer my time to do that just because these people have a very, very difficult time coping with this disability. They're literally very isolated. These wireless meters, you can't turn them off. Even if they radiate a little bit, they can be very debilitating. Some of the digital meters actually produce dirty electricity as well, so you want to look at that component. Particularly when people can find a safe place and eliminate all of their exposure, they want to be able to maintain that. Just as you heard from Joyce, she had that safe space and then it was interrupted with the installation of a wireless technology. And Marie's right, people are opting for MAID, medical assistance in dying, because they can't find safe places to live. I'm working with doctors in Europe now to help them incorporate electromagnetic hygiene and eliminating these things in their hospitals there. I want to offer my support and my assistance and my expertise to any of you, all of you, to answer any questions that you may have. It's a very, very important component for you to have this, this opt-out program without further compromising these incredibly disadvantaged individuals. If you have any questions, I'm happy to answer them.
Thank you very much for your comments presentation. Any questions at all? Okay, thank you for your time today.
You're welcome.
Our next speaker is Lisa Prefontaine, also joining us via Zoom with respect to the same item.
Good morning, Mr. Mayor and councillors. I am strongly in favor of recommendation number 1, the opt-out program. I would like this program made available to all residents, not just those who have proof of need with a medical exemption. I appreciate that a general outline of how an opt-out program might work was included in the report, and support point 2 on page 12, which states, customers who have concerns about privacy, health, or other reasons would be given the option to opt out of having a radio transmitter installed in their property. I have questions about the costs stated in the report. On page 12, the report is not clear how the meter read estimate of $79 per read was arrived at. Manual meter read costs vary between municipalities on the chart, and many are much lower. For example, Penticton is $18.75 per month, and Halifax is $50 quarterly. Can it be explained how we arrived at the $79 per meter read, per read? It seems quite high and could make this program out of reach to those who need it. Page 11 states customers who opt out could incur additional costs of up to $1,000 or $1,059 per year. What makes up this annual estimate? I find it very confusing and not made clear. By juggling around with numbers, I took a guess that it's the sum of the annual fixed fee estimate of $980 plus $179 meter read. But even this is confusing and not for certain, as there would need to be at least 2 to 12 meter readings per year, going by what other municipality programs are doing. The report seems to contradict itself regarding the estimated annual fixed fee totals. Page 6 and 12 of the report state a range of $490 to $980, and then page 11 tells us $445 to $890. The numbers don't match up. There appear to be errors, making it very confusing to follow. Where is the data for us to compare Winnipeg's fixed fee with those of other municipalities? Similar to the additional fee, why is there no mention of other municipalities paying a fixed fee annual cost? Do they pay one? What is done by other municipalities regarding additional fees or fixed fees? On page 12, the report states that an absence of any fees would require costs associated with operations to be incorporated into utility rates for all customers, estimated at $235,000 to $252,000 annually. With our 221,000 customers, the annual fee incorporated into utility rates would be between $1.06 to $1.14 per year per customer. If the profit margin for the entire project is so thin that a maximum extra charge of just over $1 per year will cause undue hardship, then perhaps the whole project needs to be rethought. Perhaps a portion of the cost could be incorporated into utility rates for all customers and or the city's profits to help make the opt-out program affordable. Page 13 states the opt-out program would be limited to customers at specific premises at the time the AMS project is implemented at that premise. Once the resident vacates the premises, an AMI meter would be installed in order to restart the service. The city would not retrofit existing AMI meters with non-AMI meters. How will residents who want to opt out after the project is implemented do so? We need to consider how we are going to accommodate people who qualify to opt out in the future. How do we accommodate people who are part of the program if they need to relocate to a different residence after the AMS project is implemented? Will people building brand new homes in Winnipeg be eligible for the opt-out program? This policy seems very time-limited, unaccommodating, and inflexible. This policy seems to be for the benefit of the technology and not the benefit of the people. I conclude by asking, would councillors please consider holding public consultation for the Smart Water Meter opt-out program? Consultation will determine what the people's needs are so that these needs can be incorporated into the request for proposal. Thank you.
Thank you very much for your presentation. Any questions? Councillor Eadie?
Yes, the recommendation that comes out of the Water, Waste and Environment Committee, it kind of avoided setting up a program as was described in the report. You were just reporting from what was described as a potential opt-out program, but essentially what the recommendation is, and you're aware of this, that the option is you can have the transmission directed away. There's a number of ways of transmitting without, well, it says in the report, and they did the study, that without sending the waves towards a human being, you could send them out. Yeah, waves bounce around when they get outside. But ultimately, what it's saying here is if there is a doctor letter or certification that you have that someone has this environmental ill effects from waves, then, or if they're already claiming the disability tax credit because their life is affected so much by that disabling outcomes from the waves, then they would have a smart meter, a digital reader without the transmission installed, and they'd have to give a reading. But ultimately, there's no provision for, they'll work with people who, you know, the privacy, but there's no, this recommendation has nothing to do with people who just, you know, think there's a privacy issue or whatever. So you're,
I would like to,
you're aware of that, right?
I am, and I would like to see if we can change that, shift that. It's so difficult to get a doctor's letter and the qualifications to be, for this to be available to people, and it needs to be expanded, I feel.
All right, thanks.
Okay, thank you very much. Seeing no further questions, appreciate your time today.
Thank you.
Okay, our next two delegations are also appearing with respect to the same item, but they're joining us in person. So I'm going to call Jacqueline Cuthbert to come down first, followed by Lyle Barkman. So Lyle, if you want to head down to the bench.
See Jacqueline at this point. Good morning, welcome. Just,
Homeowner.
there we go. You can start again, please. We just got a second to get your mic on. Go ahead, thank you.
My name is Jacqueline Cuthbert, and I am a City of Winnipeg homeowner. I'm here today to ask you to support the recommendation that the Committee on Water, Waste and Environment implement an opt-out program for the advanced water metering system. I have a medical condition, a known disability, that non-ionizing radiation aggravates. This year, on the insistence of one of my doctors, I have spent thousands of dollars working with a building biologist and a local electrician to reduce the non-ionizing radiation in my home. The installation of your Neptune meter and transmitter will add back in radiation that over time will impact my health. A small example of the difference, which is life-changing, is I went from sleeping 2 hours a night to 8 solid hours. The radiation from your Neptune and transmitter will add back in radiation back into my home and will over time impact my health. And nobody knows in what time frame it will do that. During discussions and email communication, there has been suggestions to install transmitters outside of our homes instead of offering an opt-out program. This is a big unknown. It means gambling with my health. It means doing a little experiment to see if putting the transmitter outside might be okay. And we heard from Joyce this morning, it could easily not be okay. We heard because that transmitter can still possibly trigger symptoms. I need my home to be safe and accessible based on my health conditions, my disability. I am suggesting that a very small number of Winnipeggers need to keep their current water meter and continue with providing readings to the city and perhaps free of charge on an annual basis get an inspection of that older device. I know I have an invisible disability, and I know it is hard for many people to understand or even accept that non-ionizing radiation can make you sick. Even among Canadian doctors, it has been slow to spread awareness and acceptance of the EMF-related illnesses. Many of us have had to leave our province to get medical recognition and care. So I am asking that the current wording in the opt-out program be edited in such a way to include letters from medical doctors licensed outside of Manitoba. It is a very sensitive issue for doctors to write letters and sign their name to a condition, a prescription that they do not have education around. For example, I have a medical condition that was identified out of province, and I was given prescriptions. I have been trying for 2 years already to get a Manitoba doctor, a Winnipeg doctor, to take over those prescriptions because the doctor in the other province is expecting to retire shortly. I have not had success. It's a very sensitive matter. If it's not your area of expertise, doctors have their own professional code of conduct and are very uncomfortable in signing off on something that they personally don't have training in. It is a basic human right to have access to a healthy home, and your plan for implementing the installation of the advanced water metering system needs to include an appropriate opt-out measure for those whose health depends on it. Please support the recommendation today for the opt-out program, and please support an amendment to accept medical letters from licensed medical doctors beyond Manitoba. Thank you for listening today.
Thank you so much, and thank you for being here today. Questions, Councillor Lukes?
Are you familiar with other opt-out programs across Canada?
Just a little bit. This is all very new to me.
Thank you.
Thank you very much for your time.
Okay, so not seeing Lyle Barkman, we'll move on to our next delegation, which is Linda Vanderlaar, to be heard in opposition to report number 4 of the Standing Policy Committee on Public Works. Following Linda, we'll go back to Shelley Wright on Zoom.
Good morning, welcome.
Hi, back to something else. Mayor, councillors, thank you for the opportunity to speak. My name is Linda. I use she, her pronouns. I am a nurse. I am a year-round bicycle commuter, and I'm also consciously card, as in I reluctantly own a vehicle. I am the first of 16 people speaking regarding Wellington Crescent. I am here to voice my opposition for further delays in implementation of infrastructure and speed limit changes to Wellington Crescent between Academy and Stradbroke. I am also in opposition of a 40-kilometer-an-hour speed limit, as 30 kilometers is the only safe speed on a road where vulnerable road users mix like they do on Wellington Crescent. Looking at the documentation submitted by the Public Services Department, it seems like even they are confused by the request for delay. It's quite disingenuous to still call it a pilot project if there's nothing pilot about it. The plans have been ready since February. I feel like vulnerable road users are being used as pawns in a larger political game I don't know the rules to. A type of 4D chess. How different were the vibes back in December of 2024? There was excitement. We had hope. We believed in the process. Surely Rob's death would be the wake-up call this city needed. We were understanding city center community committee, okay, fine. A councillor can't just bring forward a motion that talks about streets in someone else's ward. The motion went forward for a shorter stretch. We were disappointed, but we trusted the process. Public Works Committee, reinstatement of the original motions, 30 for the full stretch of Wellington Crescent immediately. This summer, no confusion, we were thrilled. But then came the Executive Policy Committee, and that's where it went downhill. Although a city center councillor should not touch anyone else's ward, everyone sure gets a say in what happens in the city center. I remember the things being said. Expecting drivers to drive 30 on a road that wide would basically be entrapment. If drivers get delayed by 8 seconds, they will divert to a neighborhood and it will cause problems there. And all this moved to City Council as a study. I remember the lively debate at City Council. I remember the ones who championed the motion. I remember their willingness to compromise to move it along. It fell on deaf ears and a study at state. That's when the dragging on started. One person shielded you from all of this frustration it caused among vulnerable road users. By now, some of you have heard over 100 delegations. I hope some made you listen, made you think. Every single delegate used a different angle. We recounted our traumatic near-death experiences, our traumatic losses. We talked about the science behind speed limits. We talked about policy, the World Health Organization recommendations, Winnipeg's Transportation Master Plan, Winnipeg's Climate Action Plan, Winnipeg's Road Safety Strategic Action Plan. We talked about infrastructure, lane widths, curb heights, slip lanes. It all doesn't seem to move the needle. I'm not here to rehash everything that has been said before. I'm not re-traumatizing myself in the hope you finally realize what vulnerable road users put themselves through every single day. So here's my new angle for you today, one I hope you take to heart in all the work you do until the next general election in October 2026 and thereafter. As a healthcare provider, I was taught ways to prevent moral distress, ways to deal with ethical dilemmas. We use the core principles of non-maleficence, beneficence, autonomy, and justice. The city has a duty to care to ensure public spaces are safe. The principle of maleficence, do no harm, applied to these motions as a proper reduction in speed limit and providing protected infrastructure decreases the risks of severity of car crashes and lead to fewer pedestrian and cyclist deaths and reduces injuries and fatalities. Just as I avoid harm, this city has a duty to avoid harm. Beneficence, or promoting well-being, lower speed limits and bike lanes encourages a safe driving environment, encourages physical activity, reduces pollution, fosters healthier communities, and overall improves quality of life. Justice, or fairness and equity, lower speed limits protect the most vulnerable, children, the elderly, individuals in neighborhoods where pedestrian activity is higher. Bike lanes allow people who can't afford to travel in more expensive ways safe options. And lastly, autonomy, or respect for individuals. While people who will drive will argue changes to Wellington Crescent restricts them, it enhances autonomy for others, individuals who prefer to walk or cycle, people who can't drive. Cities should prioritize community safety over individual driving preferences. As many people choose to live along Wellington Crescent so they can live an active, environmentally conscious lifestyle, one that doesn't further burden our empty coffers. So please, I ask you to allow us to live that lifestyle. Don't sleep on this. Don't stall. I want to be there for ribbon-cutting ceremonies this fall, not next year. Maybe we can even invite Marcia Marcusa to be there.
Thank you. Thank you very much. Linda, any questions at all? Okay, thank you for being here and thank you for your presentation. Thank you.
Okay, our next delegation is Shelley Wright, joining us via Zoom.
I'm going to turn the chair over to Councillor Lukes for a moment.
Sure. And Shelley is being heard with respect to item 5 of the Standing Committee on Water and Waste.
And will I be able to screen share this presentation?
Yes, we can see you.
Okay, great. I just need to screen share it. Screen 2. No, oh, sorry, screen 1. Share. Yeah, but I'm going to do this. Wait. Okay. Share. And this. Okay, I think I'm ready to go. Thank you.
If you make your screen the full screen, we'll be able to read it.
Okay, thank you so much for that.
Okay.
Thank you for this opportunity. I support item 5. I'm a retired teacher. Humans are naturally electromagnetic. People can become electrosensitive due to a head injury, health condition, or overexposure to environmental toxins. Electromagnetically vulnerable persons may feel poisoned, unable to function or participate fully in life. Health Canada's Safety Code 6 suggests 10 million microwatts per meter squared is safe. This is 100,000 times more radiation than I can tolerate. RF levels close to 100 microwatts per meter squared can cause debilitating microwave sickness for days. Wireless emitting devices send a searing pain through the posterior part of my head, including migraines, loss of executive function, skin bubbles, and rashes. A wireless water meter inside a home can broadcast strong microwave frequency spikes that exceed 15,000 microwatts per meter squared, 150 times my tolerance. Finding safe homes is increasingly difficult. Homes with non-wireless utility meters are rare and essential resource for people with medical vulnerabilities. Without accessible non-wireless utility services, people face exclusion, illness, or homelessness. Residents are opting out to preserve their health, safety, and ability to fully participate in their home environment without harm. Under the AODA and OHRC, proof of disability or medical condition is not required for public service accommodations. Opt-out fees violates principles of equality and accommodations. Electro hypersensitivity is recognized globally. Canadian doctors report this chronic illness using International Code of Diseases ICD-10. EHS is recognized as a functional impairment in Sweden, and in Canada, electromagnetic sensitivities are included in the medical perspective report commissioned by the Canadian Human Rights Commission. These medical and legal perspective reports led to the policy under the Canadian Human Rights Act. To uphold public health, inclusion, human rights, and opt-out policy would include no fees, full access to renters and homeowners, regardless of prior installations, acceptance of letters from any licensed Canadian physician or healthcare provider, no charges for relocating antennas or meters, protection for residents in adjacent dwellings, and flexibility for residents who develop health issues after installation. Frank Clegg, past president of Microsoft Canada, supports recommendation number 1 of item 5 on the agenda. With over 40 years in the technology industry, Mr. Clegg has witnessed both the extraordinary benefits of and potential harms of technology. He dedicated over a year to research the health effects of wireless radiation. Through consultations with global experts, he learned that improper implementation of wireless technology can carry significant health risks and long-term costs to public health. He co-founded Canadians for Safe Technology, C4ST, a national volunteer-led nonprofit organization focused on health and safety risks of wireless technologies. C4ST regularly hears from individuals who are harmed by emissions, including smart meters. Mr. Clegg believes the City of Winnipeg can actively prevent displacement, precarious housing, or homelessness as residents search for low EMF housing. The City of Winnipeg's $135 million plan to replace 221,000 water meters provides an opportunity for an equitable opt-out option. According to the June 27th Public Service Report, if just 0.2% of residents opt out, the annual cost would be approximately $250,000, just over $1 per meter. As with other examples of accessibility accommodations, this is a reasonable shared cost. According to the city's report, Halifax, Edmonton, and others, they have opt-out programs. Winnipeg's opt-out provisions should include the ability to change an existing meter installation to a non-emitting meter when requested, such as when residents move or want to reduce exposure to these waveforms in existing residents. Finally, Mr. Clegg respectfully recommends the city requires vendors to include pricing for non-emitting meters in the RFP and adopt a non-cost opt-out for persons with disabilities with affordable access for others without requiring medical documentation. Mr. Clegg welcomes the opportunity to provide further input by phone or video conversation. Thank you.
All right, thank you very much for your presentation. Are there any questions from committee members at all on her presentation? Thanks for sharing that on the screen. If not, thanks, Shelley, for your presentation. There doesn't seem to be any questions. Now we'll move on to the next delegation, which is Arrow Van Dyck regarding Public Works item number 4.
Hello, members of the Executive Policy Committee. My name is Arrow Van Dyck. I use she, her pronouns, and I'm a cyclist who rides around a lot in the city. I see a lot of...
Sorry.
Is there an issue?
Yeah, I'm having difficulty hearing you.
Oh, for sure. I can move in closer. Can you hear me now? Yeah?
Yes.
Okay, perfect. So I do ride around a lot in this city, all over the place. In my neighborhood, I go as far as the south end to see my family. I go up to the north end to see friends. And when I say the north end, I don't actually mean the neighborhood. I mean, I go pretty far north to go see friends. East, west, I've been all over the place. And The way that people drive in this city where there is no protected bike infrastructure is very dangerous. The Wellington Crescent gap between River Stradbrook and Academy Road is a very crucial connection that is missing and was missing when Rob Jenner was killed and is still missing today. I'm here to speak in opposition to the delay on the Wellington Crescent bike lane that is being proposed to consult with property owners along Wellington Crescent. I don't think there needs to be any reason to do the pilot project in the reverse order when the typical way to do things is to just put the infrastructure in and then get feedback from the people who live there. I also take issue with the fact that the consultation period is for property owners, not for people who actually live there. A lot of the buildings on Wellington are rented apartments. And the people who actually live there, I think, should have more of a say than the people who simply own the buildings and make money off them. Last week at the Public Works Committee, we were given a bit of a, what was labeled as a compromise. I've got pretty short remarks today. If you all need a minute to talk or look at your phones, look at your computers, I can keep this to like 1 minute and just give you 2 to sort out your stuff. I can just stand here quietly for a couple minutes.
We were clarifying a statement that you had made. He wasn't clear on it.
Maybe if you pulled your mask down so I can see what you're saying, that would be helpful for me.
I'm not willing to expose myself to viruses and expose community members to viruses that I might have and be asymptomatic for. I can speak loudly and clearly. I can lean into the mic.
Appreciate that.
And I would appreciate like eyes on your citizens when they're talking to you because
I'm not taking direction from you. Thank you very much. Continue.
Okay.
Are you done your presentation, or?
No, I'm just waiting for people to be looking at me to show me that they're listening because this is a serious issue.
You all, sir, so.
Yeah, you're not gonna have some tough luck here. Sorry.
Councillor Eady, I regret to inform you that I am a woman.
Well, I think you should respect other people.
Yeah.
They can hear you quite well.
It's a two-way street here.
It's very obvious watching from the gallery, seeing you all on your phones and on your computers that you weren't listening to us on Thursday at the Public Works Committee. I would like to actually be heard when I come here to talk to my elected officials in opposition to this meaningless delay that is putting people in danger for another 270 days. It was pointed out to me after the Public Works meeting that based on just the reported injuries and crashes on Wellington Crescent, not talking about the unreported things that happen in this city, and not talking about the close calls, just the things that made the news, on average, 1 every 270 days on Wellington Crescent. So what are we doing here, delaying it for another 270 days? This is ridiculous. The attitude towards cyclists in the city is so toxic. This morning, I spent some time looking around online to find videos of people biking in Winnipeg. Here's what Winnipeg drivers said in the comment section. Oh, mobile speed bumps. Get off the effing roads, idiots. Run them down. Legalize ramming into cyclists on the road. At this point, they are just asking for it. How many points is this? As in, like, you get points for, you know? And my last one is my favorite. It says, I would have smoked that guy, and I was the person in that video. This is what we need you to protect us from, because these people operate weapons that are like, yeah, they're used to get people around most of the time, but vehicles can be used to kill and injure people. We see that at vehicle attacks on festivals, protests around the world. Like, we've seen weapons get used in road rage. There are so many road rage incidents on our roads all the time. You see it every damn day. It's dangerous out there. I know that you guys can't tell MPI to do stricter licensing requirements, but you can make meaningful changes to what is actually on our roads. You can make changes to the speed limits. You can make changes to the infrastructure design. By leaving this for another 270 days, you are showing a lack of leadership and a lack of willingness to protect your citizens.
Okay, thank you very much for your presentation. Any questions? Councillor Lukes.
No. Did you know that when we do the consultation, we are doing the consultation to anyone, anywhere in the city, not just the landowners, not just the owners of the building, but the people that live in the apartment building. So it's a online web, people from Syria can comment if they want.
Yes, I fill these things out all the time. The specific language in that recommendation is to consult fronting property owners. That is what it says in the words that were chosen by the Public Works Committee.
Right, so,
So if it says property owners, that puts an emphasis on property owners. If you want it to say, we will consult all stakeholders, people who use the road, people who live there, people who are in the neighborhood nearby and on streets that will be affected by traffic flow changes, you can say that. What it says is property owners.
thank you.
Okay, thank you for your presentation. Have a good day.
You're welcome, you too.
Okay, next up is Robin Dick, also in opposition to Public Works item number 4, joining us in person. Not seeing, oh. Okay, and then following Robin, we'll hear from Anna Weir.
Good morning. Thank you for your time today. Go ahead.
Good morning. Thank you. Good morning, EPC. My name is Robin Dick. I'm a resident of St. Boniface. I'm a bicyclist. I'm a pedestrian, transit user, and when I have to, I'm a car driver. So there have been many delegations on this topic, so I'm going to try and not repeat what's been said. I was signed up to delegate on June 12th via Zoom. I took time out of my vacation to make sure I had my laptop, brought my laptop on my 2-week vacation in camping with my family, and I made sure I had a space where I could come and delegate, and it was canceled. And then I couldn't be here on July 3rd for the Public Works meeting because I had to work, so I submitted that in writing for your reading pleasure. But now I'm here to delegate to you on this matter. But today, I wanted to talk a bit about the compromise that was made last week at the Public Works Committee meeting. So, and again, correct me if I'm wrong, but I'm pretty sure it was a delay or a reduction in the delay from 270 days to 220 days. Doesn't matter. It was a 50-day compromise was the words that were used. So I'm just wondering, and this is not a question, it's a rhetorical question, who this compromise is for. Because it may be for City Council, for Public Works, for whoever. For us as bicyclists, as vulnerable road users, transit users, pedestrians, it really won't help us any. We needed this protective bike lane. We needed it yesterday. We needed it on June 7th. We needed it last spring and for the 10 and 15 years that Bike Winnipeg has been advocating for this stretch of road, critical stretch of road and critical section in the bike network. We needed it a long time ago. But to focus on the future, the next best time to implement this infrastructure is today, is now. So I'm here obviously in support of that. I wanted to talk about yesterday. I actually, I don't like being here. It makes me nervous. I don't like speaking to city councilors. I'm sure it's a long day for you folks. I like talking to people, and so I was on Wellington Crescent for a couple hours in the rain and the cold with some bike friends, and we were door knocking. We were handing out flyers. We were, and it's super exciting, and the vibe gets really, I get down on this because like someone else said, we've been up and down this roller coaster with this Wellington Crescent bike lane, hopeful and then super upset. But it was so exciting to talk to people yesterday on Wellington Crescent because the people who are there, they want this bike lane. They want reduction in speed. They want safe streets. They hear it. They know when cars are speeding down their street and they're scared. And so it was really good for me to get some energy and it was really exciting. And so it makes me frustrated when I see this delay. When you walk down there and you talk to people and they sign your petition and they take your flyer and they say they'll call and they're exciting. There was no opposition to it. So it just, this compromise, the word compromise is really, I don't know what we're compromising for. If it's pressure from car drivers, as we heard, there's lots of pressure from car drivers. But I don't think we can try and compromise between cars and bikes. We have to take the decision to keep all vulnerable road users safe. And that's what I'm hoping to ask you here is to protect me, protect my family, protect my other friends that are vulnerable road users. I'm totally going off script and that's where I start rambling. So I think that was the main thing I don't want to take up, I've got a minute left, but the main thing I wanted to push is that after being on Wellington Crescent, I don't know the last time any of you, I know those are none of your wards, it's Sherry Rowland's and John Orliker's ward. I don't know how often they walk the streets and just randomly talk to people. I know you councillors can do events and you talk to people at events in a very casual way, but if you're walking around on your streets and you ask people about what they want to see in their city. They told me they want a bike lane, they want safer speeds, they want 30, they don't want to hear, they can hear it, they know when they're going 80 and 100 down Wellington Crescent, they can hear it because they live right there. So that's all I'll say. So in general, in closing, I support this pilot. I support it being put in immediately, so I oppose the delay, and that's all. Life-saving infrastructure today. Thank you.
Thank you very much. Questions, all? Councillor Lucas.
Yeah, thank you. Thanks for your presentation. It's more of a did you know. So the committee wanted the public service to do the outreach because what we found many, many times in doing outreach is things are learned from the neighborhood. Like you say, walking the street, you learn things about that specific street or those little nuances that, you know, when you look at a map, they don't really come to light unless you're like on the street, right? So the public service really wanted to do that, and that was great. And then the committee wanted them to come back and tell us, what did you hear? What did you learn? Are you changing the design? So that's what we did. We asked them to come back and tell us that, because they can't build it in February or March or whatever the 220 days is. So I don't know. Yeah, I read somewhere that it was a compromise, but I didn't. That was the intent, was to gather feedback from the people that live in the neighborhood on what they know and what they hear. Because the people that live in the neighborhood, they've got a different perspective than the people that pass through it too, right? I think we all know that. So we wanted to hear that. And so, but we wanted it to come forward so everyone can hear it, and we wanted everyone to come back again and have something to speak to on the agenda. And that will happen in however many days, in February or March. So that's what that was all about. Because we know that we're not building it this year. We're not. And I know people don't like that. I'm very clear on that. But that's what that whole thing was. It wasn't, I don't know where this compromise came from, because whatever, stuff percolates up that I don't know where it comes from. But I just wanted you to understand that, because you're understanding. People on the street that live on the street have different perspectives too. So that's what that was all about. That was just to clarify that.
Yeah, I guess I wasn't aware of, like, the report said that it was atypical and that they could implement the pilot as a way, the temporary infrastructure, as a way to allow residents and whoever going through to experience it and then get feedback. So that's, I guess, what the report I thought was.
And you know what? People have come and given us definitions of a pilot and the like. And I mean, we did a lot of consultation before we're doing this new transit system, right? And there's things in this transit system that we're still hearing about now that aren't perfect, that need to be adjusted, right? So I'm okay with reaching out to the people that live in the neighborhood to get their input and others. So,
of course, as is, everything should have public input. I think it's more about implementing something, like anything now, and then doing the feedback.
And I will say, it's a did you know, that I watch what's going on across Canada with other bike lanes and things going in, and I don't want what's going on in Toronto to start happening here.
Yeah.
And honestly, and I didn't bring that up at the last I haven't brought it up at all, but I can tell you that we need 9 votes to get something through. And I want to get this through, but I need 9 votes. That's the game here at City Hall. It's 9 votes, right? And when I see what's going on in Toronto, and I don't want that happening here, because we put a lot of time, effort, money, study, blah, blah, all of that. And there's all you have to do is read the websites, read the Facebook comments, right? Like, you know, there's this very polarizing world of cycling lanes and sharing the road. It's a concept that's very hard for some people to comprehend. And I'm concerned about that. And I need that. We need those 9 votes to get it through. And we don't want to have a big backlash of ramming something in and having the backlash and not getting 9 votes for the next project or whatever. you know, like I thought it would be a lot easier on this side of the table, but it's not. There's a lot of other dynamics, and I don't want to see what's happening in Toronto happen here, and I don't want to upset and really create even more polarization than we see, because I get the emails when I say I support 30, when I support 40. I get the people that lose their minds that drive vehicles, right? I think I'm one of the top on the hit list for Wise Up Winnipeg. So, you know, yeah, I just want to share that with you.
Thank you. Thank you very much for your time today and your presentation. Appreciate it.
Thank you very much.
Thank
Have a
you.
great day.
Okay, our next two delegations also joining us in person with respect to the same topic are Anna Weir, followed by Libby Weir, and following them, we'll move on to Magda Havas.
Good morning.
Hi, good morning. My name is Kate. I just spoke with Anna about taking her place before I have to leave. Is that okay with
That's
everyone?
fine.
That's fine? Okay. Thank you very much.
That's good.
Good morning, councilors. My name is Kate Geringer, and I am, great time to jump into this conversation. I am a resident of Crescentwood. I'm here today to implore you to remove the delay and install a bike lane on Wellington Crescent as soon as possible. As some of you heard last week, I live only 500 meters from where Rob Jenner was killed on Wellington Crescent last year. This stretch of road is a big, dangerous gap between better, more protected routes on Stradbrook, Maryland, Sherbrooke, and the speed-limited route on Wellington, west of Academy. Having a protected route and a lowered speed limit here would be beneficial to the residents of my neighborhood, as well as people from all parts of Winnipeg who want to visit the area or connect to different parts of the cycling network. We want to get around by bike without worrying that we could be the next ones to die or lose a loved one here. I will reiterate that it's been more than a year since Rob Jenner was killed without any concrete action being taken. This is a disgrace in itself, but the Public Works Committee's continued insistence on waiting another 220 days to even consider making a change is an insult to his memory. I tried to put this in more gentle terms last week, but the committee appeared to be unmoved by my comments or the harrowing stories of dozens of concerned cyclists. City Council claims to want feedback from the community, but we're right here in front of you, asking you to help keep us safe. Last week, 48 people rearranged their schedules and took time off to come here and show you how important this is to us. If these meetings were more accessible to working people, it would undoubtedly have been an even greater number. I live on Grosvenor Avenue. I was brought here by another friend who was by Zoom last week, who also lives on Grosvenor. I'm here with two friends who live in Macmillan, another who lives on Wellington proper. I could think of others just off the cuff. The public service report states that this long consultation period is atypical and unnecessary. Robin just spoke to that. So it doesn't make sense to tell us that these things just take time. We know that we could have a bike lane in place for this year's summer cycling season. In closing, I request that you please consider amending this pilot project and take immediate action to keep Winnipeg cyclists safe.
Thank you very much for your presentation. Any questions at all? Okay, thank you. Thank you for being here. Thanks. I'm glad it worked out to accommodate you early here.
Thanks very much.
Okay, thank you.
Okay, so since Kate and Anna have switched spots, next up we'll hear from Libby Weir, and then following Libby, Magda.
If I may, if I don't know, I've just seen the last name, so I might be wrong. If Anna and Libby Weir are you together in the same? Because no sense. No, but in no sense making one wait, like for. So I think we'll hear you right after we hear Libby. Okay. Thank you very much. Libby, go ahead. Thank you. Welcome. Councillor Duncan's gonna move the microphone for you. Okay. We want to make sure we can hear you. Thank you very much. Okay, and go ahead.
My name is Libby. I am 9 years old, and I use she, her pronouns, and I love biking. And I'm horrified that it's possible on roads for people to die just living their everyday lives. I don't want any more cyclists or pedestrians to die because drivers were careless or driving too fast. I delegated at Public Works last week and heard a lot of delegates say that they had stopped biking because they felt unsafe. I hope that no more cyclists stop biking because they are afraid of going near cars, because they are big metal machines that go super fast. So that is why we need a bike lane on Wellington Crescent now.
Okay, thank you very much, Libby. I appreciate your presentation. Very clear. Any questions at all? Councillor Duncan.
Hey there, thank you very much for coming out and speaking today. I just wanted to let you know that I think I have a daughter that's just about your age, and she says a lot of the same things. So I just wanted to let you know that there's other little kids out there that are your age that are thinking and saying the same things. So thank you again for coming out.
Thank you. Madam Clerk, why don't we hear Anna at this time then? Yes, go ahead. Thank you.
Thank you. Good morning. I'm Anna Weir, and I'm speaking against the pilot bike lane on Wellington Crescent. I definitely do want to see a bike lane on Wellington Crescent, but I would like to see it without delay, and I would like the posted speed limit on Wellington Crescent to be 30 kilometers an hour to provide safe cycling and pedestrian infrastructure. I'm here today because Rob Jenner died over a year ago on Wellington Crescent, and last night when Libby and I were preparing our delegations, we read Rob Jenner's obituary again to keep him top of mind because we are so sad that a fellow cyclist, a fellow Winnipegger died on the road on Wellington Crescent over a year ago. And that is one of the reasons why we would really like to see safe infrastructure on that stretch of road. I've used my bike for transportation in Winnipeg for over 20 years. I have been the kind of cyclist who rides on roads without any bike-specific infrastructure, largely due to the fact that I have places that I need to get to where there is no safe infrastructure. And having interactions with cars that put me in danger has been a daily occurrence. I've seen changes in cycling infrastructure over the last 20 years, and I am grateful for the new facilities, but not enough has changed. There are still so many places in the city, especially central Winnipeg and the North End, where it's not possible to get to places using safe infrastructure. And something changed for me 9 years ago. You met Libby. I had a kid, and before having a kid, I was a vulnerable road user. But now I think about riding bike in a different way because I want to be a family that bikes. I want to bike with my kid. I want her to know that riding a bike can feel like pure joy. And as much as possible, we didn't want to contribute to climate change, and that's another reason that we wanted to ride bike with our daughter. We wanted to demonstrate to her that being outside and moving our bodies is a foundational and lovely part of life. We wanted to have all those great community interactions that hopefully you folks have also had, where you're riding a bike down the neighborhood, you see a neighbor, you see a friend, you wave, you can interact with each other. And that's what I want Libby to be able to experience in Winnipeg. But now when I make decisions about where to ride bike, especially with Libby, I really think differently about safety. So as an example, a month ago, Libby and I went to the block party for Rob Jenner's birthday and the anniversary of his death. And it actually took me a really long to decide how we would actually get there. Despite the fact that it was a bike-focused neighborhood event, I actually considered driving because I couldn't think of a safe way that Libby and I could bike to that part of Wellington Crescent where Rob was killed. We did end up riding bike, but we made a lot of accommodations and we noticed a lot of things. I didn't feel safe having Libby ride her own bike, so I had her on a trail-a-bike, which is kind of a bike attached to my bike. We didn't feel safe on the street, so we took the sidewalk, which I know is not ideal because it's intended for pedestrians. And there were no curb cuts at key locations where Academy attaches to Wellington Crescent, so it wasn't easy by bike, but it also wouldn't be easy for folks using wheelchairs or having strollers. So, you know, there were a lot of things that were still quite unsafe, even though safety was top of mind for me. The continued delay on this issue is unacceptable. More and more Winnipeggers are out riding their bikes. That was true last summer. It's true this summer. And it's been over a year since Rob Jenner was killed. And with this proposal, we'll be waiting another year or longer until we have safe infrastructure on Wellington Crescent. We need action on Wellington Crescent so that me and Libby can bike there safely. We need safe infrastructure on Wellington Crescent so that our bike network can have connected facilities. We have, you know, the part of Wellington Crescent where there are lower speeds. We connect to River and Stradbrook, but there's nothing in the middle in terms of safe infrastructure. And because this is a pilot project, we could just put it in this summer. It could go in this summer. It's temporary infrastructure, and we could continue to gather information from people. For the whole last year since Rob Jenner died, there was an opportunity to interact with people, to gather information, and we could continue doing that after putting in bike infrastructure this summer. The safety for Winnipeg cyclists and pedestrians cannot be delayed. I don't want to see someone injured or killed in the next 220 days while we're waiting for this infrastructure. We need more cycling infrastructure and fewer delays. And I have already been waiting for 20 years to have a bikeable city where I don't have to take my life into my hands to grocery shop, to visit friends, and I don't want to wait another 20 years. I would like to see safe biking infrastructure on Wellington Crescent now.
Okay, thank you very much for your presentation. Any questions at all? Okay, thank you very much. Appreciate that.
Our next delegation is Magda Havas, joining us via Zoom with respect to item 5 of the Standing Policy Committee on Water, Waste and Environment. Magda, if you want to go ahead and unmute yourself and turn on your video, you have up to 5 minutes for your presentation.
Good morning, welcome.
Good morning. Let me just start my video, share my slides.
Okay, we can see it. Thank you.
Wonderful. Thank you very much. My name is Dr. Magda Havas. I'm a retired professor, and for the past 30 years, I've been studying the biological effects of electromagnetic fields. I help educate medical doctors, and I provide expert testimony in legal cases dealing with radiofrequency radiation. I'd like to speak in support of the opt-out program, and I'd like to focus on Health Canada, asking the question, does Health Canada's Safety Code 6 protect the public and workers? The answer to that is yes, when it comes to shock at low frequencies and when it comes to heating at high frequencies. However, the answer is also no, because Health Canada does not take into consideration non-thermal effects other than shock. Safety Code 6 provides the guidelines for radiofrequency exposure and does not differentiate between effects on a 200-pound male, which is what it was originally intended for, military operations and exposure to radar. Safety Code 6 says pregnant females, infants, and elderly can be exposed to this radiation, which is absolutely wrong. Safety Code 6 does not consider any of the biological effects that you can see here, from cancers to neurological effects to hormonal effects. When we have technology that's wireless, it emits a pulsed radio frequency. And you can see here different cycles of this frequency. There's something called peak power, which is the highest intensity, and average power. Health Canada's guideline averages exposure only over a 6-minute period. They don't even consider or measure peak exposure. And they make the assumption that this is safe for anyone exposed 24/7, 365 days of the year. According to Health Canada, Canadian radiofrequency limits are the most stringent science-based limits in the world, and this is absolutely false. Here we see the power density, which is the intensity of the exposure for different countries. Canada has 10 million microwatts per meter squared, as you can see here. Toronto has 100, and sleeping area in Germany is 0.1. The interesting point here is that this 0.1 is strong enough for cell phone reception and for a lot of other wireless technology to function. The guidelines globally fall into 2 different categories: short-term exposure, which are the thermal effects, and long-term exposure, which are more precautionary and include other effects other than simply a change in temperature. So the safety code limits in Canada are actually among the worst in the world, not among the best. In 2022, the International Commission on the Biological Effects of Electromagnetic Fields wrote this scientific publication looking at the evidence based on Safety Code 6 on the guidelines presented by the Federal Communication Commission and another international independent group called ICNIR. These limits were based on results from behavioral studies conducted in 1980s. Now, that was before we had the rollout of cell phones. Less than 10% of the Canadian population had cell phone subscriptions. It was before smart meters and before Wi-Fi, which are some of the greatest exposures that we have in our living environment. They looked at the behavior over a 40 to 60 minute exposure period of 5 monkeys and 8 rats. Now, I don't think you have to be a scientist to recognize how inadequate this is. When it comes to the assumptions that they made, they said the biological effects were due entirely to excessive tissue heating and that no effects could occur below this thermal guideline. And that's simply false. They provide 230 references, and this applies to Health Canada's Safety Code 6. These are the 14 flawed assumptions, and what I have here in green are the results why those assumptions are flawed. I'd like to just point out 2 of them to you because of the time limitation. The Safety Code 6 thermal limit is inadequate to prevent harm, since we have literally hundreds, if not thousands, of studies showing adverse health effects documented below the thermal limit. And we have no scientific evidence that the chronic exposure is going to be safe. All we have is studies for short-term acute exposure.
Dr. Voss, I don't know if you heard, but the time limit has just gone off. Are you close to being done there?
I'm on my very last slide.
All right, thank you.
When it comes to Safety Code 6, it is not protective of either the public or workers. Wireless technology should be restricted to mobile devices. If it's stationary, like smart meters, it does not need to be wireless. And exposure from smart meters is going to be chronic. Thank you.
Thank you so much. Any questions at all? Okay, thank you very much. Appreciate that. And of course, your presentation will be part of the submission today. Thank you.
Excuse me. May I answer 2 questions that I don't think have been sufficiently answered that your councillors have requested?
I think Councillor Eadie has a question here, first of all. So let's go to Councillor Eadie, please. Councillor Eadie?
Okay.
So we're getting all this science thrown at us. The recommendation in here is that, you know, if a doctor or, well, a doctor acknowledges that there's ill effects for that individual from these radio waves, you know, that's confirmation. We're in no position to judge science and stuff. And really, my question really gets to is, like, it took how many years for fibromyalgia, an invisible disability as well, to be acknowledged, right?
Exactly.
But systems didn't stop, you know, until it gained it, then we had to acknowledge it, and there's accommodating a person with a disability, right? So, do you see that? Like,
well, you have a very difficult task ahead of you. You're being provided with technical information, and you're being provided with very diverse.
to differ with, right? But
I agree
you
with you.
differ with the other scientists, right?
Yeah, I agree with you. You're in a very difficult position. However, I think the scientists fall into 2 categories, ones that are pro-industry and ones that are independent. And it's mostly the pro-industry scientists that are providing what I would classify as misleading information, and in some cases, false information. And unfortunately, that comes through via Health Canada as well. Now, one of the questions that was asked was if you have a digital...
Sorry, I don't know that anyone... there was no other questions, I don't think, today that were posed. So because of time, and we have several other delegates, I just need to respect the time of all the other delegates as well. So are there any other questions that are being posed here by councilors? Okay.
Did you want to know whether if you turn off the radio frequency from a digital meter, whether that's adequate? That was one of the questions, and it hasn't been answered. And the answer to that question is it's inadequate because digital smart meters also emit dirty electricity that's harmful. So I'll leave it at that. Thank you very much.
Thank you very much. Okay, thank you. Okay, the next item, or
Our
next
next-
delegate, pardon me?
Yes, our next delegation, both of our next two delegations are going to be heard with respect to item 4 of the Standing Policy Committee on Public Works. Joining us in person, first we'll hear from Lucky Adams, and following Lucky by Saru Chahal.
Hello, welcome.
Good morning, City Council. Good morning, Mayor, and all the staff here. Thank you for listening to me today to speak on item number 4, Wellington Crescent. My name is Lucky Adams. What I am asking is for a removal of the 220-day delay from the item, which is the pilot project for a bike lane on Wellington Crescent. Ideally, delegations should have some influence on the vote and not just be a formality. I think that's what we would all like to see. And yet we've seen a lack of engagement from City Council members. For example, Councillor Jeff Rawadi has been on his phone for most of the morning.
Okay, sorry, you know, you have a presentation to make. You don't have to point out any councillors. We're listening, we're attentive, we're here. You have, right now, you're at the most accessible level of government that will hear you out. So if you have a presentation specific to what you want to talk about related to Wellington Crescent, you can do that, but I'm not going to permit you to point out city councillors. So you're here, you've got audience, go ahead.
Well, I have a partial audience.
Would you like to continue?
Yeah, I'll continue.
Carry on then.
So it's normal for the city to not add cycling infrastructure to roads unless they are scheduled for a road renewal, even when it's known that those roads are unsafe. Wellington Crescent is an example of such a road. Just last year, Rob Jenner was killed while cycling down Wellington Crescent. This policy of not making improvements to road infrastructure unless they're scheduled years and years in advance is bad policy. What this leads to is a disjointed cycling network where lanes connect to nothing. We see that most vividly downtown, where on a map you'll see green lines just scattered about that don't connect to other green lines, those being bike paths. On the topic of Wellington Crescent and the delays, Councillor Lukes said they can't be built overnight. She said that repeatedly on the subject of Wellington Crescent. Unfortunately, she's not here right now, but I'll carry on. It has been hundreds of nights, however, since Rob Jenner was killed. People speak of how consultations are important for property owners and the people who live in the community. However, it's been months and months and months, and there's been nothing to show for it. Not because there's not enough passion or interest in such a project, but there's not the political will from the city government. On June 11th, Councillor Lukes also spoke to the CBC in an interview responding to community outrage about the slow rollout of bike infrastructure on Wellington Crescent. This followed the one-year anniversary of Rob Jenner's death, which was also one day after his birthday. That day was commemorated with a block party and a community-built bike lane, which the city promptly took down. In that interview, and I wish she was here, but I'll carry on because I know we're all busy, Councillor Luke said, until road renewal is done, there could be a temporary bike lane on Wellington Crescent, which would essentially be concrete curbs with poly posts, which is surprisingly very similar to the community-built bike lane, which was made of tall reflective posts and cinder blocks, among other materials. To remove this bike lane, there was no feasibility study, no consultation with the people living there, no pilot, no budget was even drawn up, and no feedback was gathered. In the same interview, Councillor Luke said no infrastructure would have saved Rob Jenner's life since the car was going so very fast that killed him. It was going over 150 kilometers an hour. The Public Works Committee not only hasn't implemented safe infrastructure on Wellington Crescent, but it appears that they don't even know what it is. It's shocking to hear Councillor Luke say that. And as another delegate said last week, that is pure conjecture. There are traffic barriers in the city today that could have prevented Rob Jenner's killing. There are concrete blocks that are around 2 or 3 feet tall, weighing hundreds of pounds, that exist in the city right now, but they mostly exist to protect cars from other cars. They're popular, or they're common on bridges. Not only would barriers provide a crude solution, but narrower streets could also be beneficial to safety. It's well documented by experts in traffic engineering that narrower roads, especially at intersections, leads to more cautious driving. This is known as traffic calming, and it's well established by experts in the field. Drivers choose lower speeds without any enforcement necessary. Again, I'll close by saying what I want to see is a removal of the delay. Welcome back, Councillor Lukes. I yield the floor.
So, yeah, thank you very much. I just have to say, as the chair of this committee, any delegate that take what I would believe would be a condescending tone, you end up kind of actually getting the reverse outcome that you're seeking. So I'll just say that. Yeah, I'm just so you're aware. So thank you very much for your presentation today. Next delegate?
If I may respond to that, because
go ahead.
this is an
Councillor
opportunity for
Duncan.
your questions,
you.
and it is my opportunity to respond. We've seen a variety of different tones.
Yeah.
Thank you very much. Councillor Duncan, do you have a question at all for the delegate?
I just wanted to ask you, or maybe it's are you aware that there are active transportation advocates and supporters that sit on this committee and on council?
I'm not aware of any such advocates
Okay.
on this committee.
So, I mean, I'm trying to be as kind as I can in this, but are you aware that you don't do yourself any favors by bringing your type of presentation today in being confrontational on the floor of council? You're doing yourself no favors, and I mean, I'm sure there'll be catcalls on this comment too, but when you have your other strong advocates for cycling infrastructure doing catcalls from the audience, they also do themselves no favors. I mean, are you aware that there are other people outside of your circle that also enjoy biking in the city of Winnipeg that don't insult people that have a different opinion, or that have other work to tend to, or that might want to see this implemented in other ways?
I'm not going to take advice from somebody who does not share my political goals. You do not want this effort to succeed, so I'm not going to take your advice on how to make it successful.
So, again, with all due respect, I mean, that's your opinion and you're entitled to it, and we'll see how it all plays out.
Thank you.
I
Thank you for your
appreciate your time.
presentation.
Thank you.
Okay, our next delegation is Saru Chahal, also appearing in opposition to Public Works item number 4, and Saru is joining us in person.
Hello, council members. I just want to start by saying that it's quite telling and on brand that council members are focused more on tone than people getting killed in bike lanes.
Do you have a presentation?
I do.
Please make it.
I am a paramedic, a cyclist, and a previous property owner of Wellington Crescent for over 8 years. I still live in the area, and I can tell you, after building community in the neighborhood for over 12 years, people want bike lanes on Wellington Crescent. Bike lanes save lives. I've been a paramedic for 13 years, and I can honestly say I've never responded to a cyclist accident in designated bike lanes. I have, however, been to multiple, I thought of 9 incidences as I wrote this, cyclist collisions on roads that do not have bike lanes. 2 of those incidences were fatal. I've seen people's heads cracked open. I've seen mangled body parts. I've heard the screams of family members. Maybe if members of this council were able to experience something like that, you'd finally take some meaningful action, because obviously the tragic death of Rob Jenner and others wasn't enough to spur this council into action. Personally, I've been hit once and run off the road once on Wellington Crescent due to distracted drivers. I've had 2 other incidences where vehicles were 2 inches from me while passing, almost clipping my elbow. One of the passengers of the vehicles actually yelled out, "We'll get you next time." I came out mostly unscathed. That cannot be said for others. Last month, in a completely undemocratic move, the delegation was delayed. You chose not to hear from the community, which is your literal job as elected officials. People arranged childcare and got the day off work to come and speak to this important matter. It's so incredibly rude and entitled to think that your time matters more than ours. I'm not sure why Janice gets more power than others and is so vocal about this issue when this isn't even happening in her district.
Excuse me, pardon me. First of all, it's Councillor Lukes, and you speak to the matter on the item. You're speaking about things 2 meetings ago. Please speak to the item related to Wellington Crescent and the report that's before us.
All right. Seeking input from exclusively property owners on Wellington Crescent before even launching the long-delayed pilot project is completely nonsensical. This is yet another incident in a series of stall tactics. Reducing the implementation of the pilot program from 270 days to 220, conveniently ending in February, is not meaningful compromise. It reflects bad faith. I don't know when it became acceptable for elected officials to disregard public interest in favor of personal agendas. That does lead to authoritarianism, unless that's the plan.
Excuse me, like, you're way out of line.
How so?
This is not personal agenda. What we're asking for, as you know, is we're going to consult. We're hearing from you.
Okay.
We've heard from you before. We're going to hear likely from you again. Fine. But we also want to hear from the area residents. So that's not about authoritarianism. So
I am an area resident.
Yeah, so you're mischaracterizing the process. So if you've got 1:37 seconds left, so if you could speak specifically to the agenda item.
Wellington Crescent property owners do not own the road. Therefore, their input should not be solely considered. Public infrastructure should serve the public and should not be based on a privileged few. Cyclists across Winnipeg rely on Wellington Crescent, and they deserve to do so safely. Over the past few years, the city has expanded significantly. Costs are rising, and despite the millions poured into rapid transit, the system has fallen short of expectation. City officials continue to encourage residents to park and ride or opt for alternative modes of transportation, like cycling, to ease downtown congestion and compensate for limited parking. And yet, the absence of dedicated bike lanes on major routes like Wellington Crescent defies all logic. This council at times lacks vision. Winnipeg has so much potential, but time and time again, you've chosen complacency over progress. Currently, we don't need a perfect bike lane. We just need a bike lane. Let this be a reminder, every one of you is accountable and replaceable. If another person is killed cycling down Wellington Crescent, this council will solely be the ones to blame. I'm finished.
Thank you for your time.
Any questions?
That's
Did you know? Okay, I won't, that's fine.
okay. Thank you for your time today.
Our next delegation is Tim Fennell, and Tim was registered to speak to us via Zoom, but I don't see him in the waiting room, so we'll move on. We have next up Jason Ward. And following Jason, we'll move on to Jennifer McBeath.
Good morning. Thank you for your time today. Go ahead. You have 5 minutes, please.
Good morning. Good morning, councillors. I would want to say thank you for the opportunity to speak today. However, for better or worse, this is the due process. Whether or not you want to listen to me and many others talk about Wellington. So I'd like to apologize. I know you don't want to sit here through all of this. I don't want to be here either. But the reality is this issue is about whether or not I make it home alive to see my family. I'd like to acknowledge...
Just before you go further.
Pardon me.
I'm glad to be here.
Yeah?
I want to hear from you. I want to hear from others. Right? We do. We just there's an effective way to be a delegate.
For sure.
There's a very ineffective way. We've seen a bit of both today. Carry on.
Absolutely. I'd like to acknowledge the immense effort from the Department of Public Works that has gone into the proposal, as well as the championing of the motion by Councillor Rowlands. I'd like to also acknowledge that the city has made some great strides towards improving AT, as evident of the number of folks speaking so passionately about this issue. I'm speaking in opposition today, primarily because it delays the necessary improvements, but also because it fails to implement the safest evidence-based speed limit. While I'm happy to see the proposed reduction from 50 to 40, it does feel like a half measure that isn't backed by best practice. If we look east of Toronto, we can see a research study that examined the effects of reducing speed from 40 to 30, which found 28% fewer vehicle pedestrian collisions and 67% fewer major fatal injuries in those collisions. If we look west of Edmonton, school zone speed reduction from 50 to 30, we see results of 45% reduction in severe and fatal collisions and a 55% drop in injuries to pedestrians and cyclists. These aren't just numbers or trivial changes, they represent real lives at stake. I absolutely love Winnipeg with all of its flaws. It's not Amsterdam or Hoboken, but I'd like to think we can do as good as or better than Edmonton and Toronto by taking actions that match our ambitions of Vision Zero. In regards to the unnecessary delay, on December 4th at EPC, Public Service was directed to work with community partners, including Bike Winnipeg, to support targeted stakeholder engagement, focusing on, quote, potentially impacted fronting property owners, and that officers of the city be authorized to do all things necessary to implement. So from my interpretation of that is there has been an opportunity for consultation for property owners and residents to reach out. Last week, we did not hear a single person opposed to the proposed plan. In fact, we have heard then and today from residents living on Wellington that support the immediate action. The city's commitment described this as a pop-up pilot, emphasizing rapid implementation and immediate safety improvements, and subsequent consultation based on real-world feedback. Yet, despite acknowledging in the report that installation is still feasible in 2025, the current recommendation pushes implementation into spring 2026. This approach is even described in the report as atypical. And just last week, we heard from the Associate Professor of City Planning at the University of Manitoba on how this is not the way to go about a pilot. My question is, why the change? If there are internal stakeholders pushing back, why are we not hearing those reasons from them directly? Something else to note, at the July 3rd meeting, a motion was made to make Wellington the top walk-bike design study for 2025. In my opinion, this isn't necessary. I didn't get to hear all the delegations, but I didn't hear anyone asking for this. What I did hear when listening last year to Councillor Santos talk about the valid criticism that communities south of the Assiniboine receive, unfair priority in funding. I believe moving this stretch, asking for further money spent on consultation would be another example of that unfair treatment. The reason I'm here today delegating and alive is because of temporary bike lanes on Wellington, on McDermott and Bannatyne. They enable a safe connection to my work. We don't need perfect, we just need something. So with that, I urge council to amend the proposal by setting the speed limit to 30, consistent with international evidence, the rest of the street for much of the year, and the city's stated goals of prioritizing vulnerable road users, and implement the pilot infrastructure in 2025 using the low-cost, movable infrastructure already described in your plans, thus fulfilling the original promise of timely action. And if so, you can omit the motion to make Wellington a top priority for the walk-bike design study as a permanent implementation. I'd like to thank you for your attention and considering these adjustments.
Thank you very much, Mr. Ward. Appreciate that. Any questions at all? Okay. Thank you.
Thank you.
Thank you. We have, people have commitments from between noon, I know, and probably 1:30, so we'll hear one more delegate, and then we'll break at noon until 1:30.
Okay. Our next delegate is Jennifer McBeath, joining us via Zoom. And Jennifer is appearing with respect to water and waste item number 5. Hi, Jennifer, if you want to go ahead, you can start your presentation now.
Okay, thank you. Hello, Honorable Mayor and Council members. I've lost my voice this week, but I'll do my best. Thank you for providing the time for me to speak today. I'm speaking in support of the recommendations to have an opt-out program for the advanced metering system. 5 minutes is not a lot of time, so I'm asking that all of you please read my written submission as it goes into more detail with included documentation and will provide a more thorough explanation of my concerns. I suffer from electromagnetic hypersensitivity disorder, so I'm here to speak for those of us who are already suffering due to environmental radiation, most of which we have no control over. I have done everything possible I can to make my home electromagnetic radiation free. I have had my entire home hardwired so that I don't have Wi-Fi radiation being emitted within my house. All devices have cords which go directly to the router. I have removed all wireless phones from my house and replaced them with a single hardwired line. I have had my electrical wiring looked at by an electrician to look for wiring errors, and I have paid for online meetings with a building biologist to help me reduce the EMF in my home. Even so, I suffer negative effects when I go to church, to work, to the homes of my friends, public places, etc., due to the constant exposure to Wi-Fi and the emissions from cell phones, Bluetooth devices, and cell towers. It took me 5 years and dozens of wrong turns, futile testing, ineffective and harmful pills, thousands of dollars, and prolonged suffering before I discovered, after much research and almost by accident, what was causing my pain and other symptoms. When I heard last year that smart meters were going to be implemented across the city and that I might need a doctor's letter to opt out, I think I was the first person in the city to race over to my doctor's office to obtain one. I want to ask today that you not only create a robust opt-out program, but that opting out will carry no cost to the homeowner. That it will also be available if I move to a new residence, and that after the advanced meters are installed, after a new exposure, such as a smart meter, has been introduced into their environment.
Jennifer, sorry, can I just interrupt you? Do you mind, maybe, you're breaking up a bit, do you mind turning your camera off, because then maybe the audio will come through clearly? We've paused your time, so you can carry on. We'll let you go ahead and shut your camera off.
Sure.
And, okay, carry on, please.
Okay. To be honest, I am tired of being seen as an inconvenience to people's desire for constant access for more technology. This includes the public service, who at the February 27th meeting made it clear that those of us who wish to opt out are wrecking their smart meter rollout plan. He did not want to give us any kind of opt-out because it would be inconvenient. Human health and well-being is having to take second place to technology, and I think this is wrong. I have 3 more points and very little time, so I'm asking that you please read my written submission. Number 1, it is clear that the public service has not done due diligence in assessing the harms from these meters by consulting independent scientists and doctors, as Dr. Magus has said. Number 2, the public education plan proposed by the public service will be more of an industry talking point plan meant to promote and market smart meters to the public. It will not contain any warning information on what symptoms to look for in case you are one of the unlucky people prone to EHS. Nor will it contain information for doctors so that they know what to look for when a patient comes to them with newly acquired unexplained symptoms. And number 3, the public service says its goal is to make it more convenient for customers and the city by obtaining monthly readings without bothering the customer. Yet in the February 27th meeting, the public service indicated that transmissions will be multiple times per day and that it is only a concession to sick people that the transmissions could be reduced to once per day or once a week, etc. If the stated motive for introducing smart meters is true, then why are transmissions not submitted once per month for everyone, reducing the electro-smog produced in the city and minimizing potential health risks generally, and yet still accomplishing the stated goal of the city? If there are other reasons that require multiple transmissions per day, then why are they not openly stated for the sake of transparency? I would really like to know why they have to be transmitted so many times when once a month would be adequate and would protect more people's health. A final word I'd like to say is, if the public service will not do due diligence when making sweeping changes to our basic infrastructure that will increase the electrosmog in the city and are known to be detrimental to the health of at least some people, then who is going to do that due diligence? Will city councillors do it before they vote on this? There are many of us in the community who are more than happy to provide information and research on the known health risks. The research is publicly available. The only thing stopping it from being found is choosing not to look for it. Thank you.
Okay, thank you very much for your submission, and you were, thank you. With the camera off, you were much clearer, and you have presented a submission as well. Thank you. Any questions at all today? Okay. Seeing none, thank you again for your time. Appreciate that. And at this time, then, we'll break and reconvene.
Thank you very much.
Thank you. We'll reconvene at 1:30. Thank you. Thank you. Good afternoon. We'll reconvene our Executive Policy Committee meeting for July the 8th.
Okay, so I think we ended off with Jennifer McBeath. So next up, we'll hear from Hillary Rosentreader with respect to item 4 of the SPC on Public Works. And Hillary's joining us via Zoom.
Hello, welcome. Thank you for your patience. Go ahead, you have 5 minutes.
Hello, thank you. Hi to the Executive Policy Committee, city staff, and those in attendance in person and online. Of course, I would appreciate your attention for the next few short minutes as I take time from my workday to join yours. I will say I'm disappointed and believe it's in poor taste, having seen a bit from this morning, for some to react negatively and tone police when members of the public are genuinely so passionate in their appeals to this committee on the issue being discussed. But with that, here are a few short points that I would like to speak on. First, this policy should include a reduction to 30 kilometers an hour on Wellington Crescent. The many people who live along this road, and there are many, deserve peace and to live on a street that is safe. We have the proof, and the science does show how big of a difference it is between what happens to a human body when it's hit by a vehicle traveling at 30 kilometers an hour versus 40 or 50 kilometers an hour. It is a life or death difference. Next, on the pilot status, Councillor Luke spoke about wanting to hear from people ahead of the pilot. Of course, I love her enthusiasm on hearing from stakeholders. That's the energy that I love to see from this committee and would love to see more of from the rest of council. But I would like to push back and insist on reality, which is that the point of a pilot is to let people concretely experience how those intricacies that Councillor Luke spoke about of the neighborhood are actually impacted by the real changes proposed by city staff for the route. So my ask there is just please carry this out as a pilot without any unusual and harmful delays. On consultation, of course, consultation should never be limited to landowners only. This is a public road, so I believe it's important to urge this committee to change the wording to ensure that all residents and the general public have a say regarding what happens along their street. Again, not only landowners. And lastly, I've really appreciated the glimpses of passion I've seen from a few on the committee, and I look forward to, of course, Councillor Lukes for obvious reasons, Councillor Duncan with his daughter in mind, and Councillor Santos, who I really hope knows that we will show up in support of her if she puts a motion forward in her ward for safe streets, to be among the 9 votes that will be required when this issue gets to full council. Thank you.
Thank you very much for your presentation. Any questions at all? Okay, thank you for taking time out of your day. We do appreciate it.
Okay, our next delegation is Ariel DeRoche, followed by Kyle Finez, and then Ariel Villerin, all on the same subject, and all joining us in person.
Hello, welcome.
Good afternoon, Mayor Gillingham and council members. My words again today are going to be brief. I feel like there have been many excellent points today made by my fellow delegates in opposition, but I am here once again to oppose the delay of the Wellington bike lane pilot project and implore you to reconsider. Everything I have read in the report, as well as comments from the manager of transportation planning at the July 3rd meeting, have indicated that this project is ready to go and that bike lanes could be installed right away. My frustration, and one that I am certain is shared amongst all or many of the delegates, is that there have not been a substantial reason provided for the delay of these lanes. The traditional pilot format allows for feedback in a manner that would allow for changes should anyone, for a reason I cannot imagine, find that this project is detrimental to their daily life. It is difficult to provide feedback for something that does not yet exist. I feel that the project needs to be experienced to actually be able to provide proper feedback. I would ask council to reconsider this when they are making their choice. I, as a young person working in the environmental sector, am desperate for changes in the city that will lower our dependence on cars. I want people to feel safer. I want cyclists to be treated like the drivers whose needs seem to often come first. I urge City Council to approve this project for 2025 rather than wait any longer. Thank you.
Thank you very much. Appreciate that. Any questions at all? Okay, thank you for your time and for waiting today. Appreciate that.
Okay, next up is Kyle Finez, joining us in person. Okay, they're not here, so we'll move on to Ariel Villerin. And following Ariel, Marika Howell-Favel. So if Marika's in the audience, they could just come down to the bench.
Good afternoon, welcome to both of you.
Well, you're heavy now. Good afternoon, Your Worship, councillors. I'm Ariel Villerin, and this is my friend Orion, who wanted to come down here with me. Thank you for letting us speak today. I'm joining you today with a terrible migraine, but holding you accountable is important, and that's why we're here. I want to also recognize that many other people who cannot be here today because of many different things like work. So, you know, when Your Worship, you say that this is the most accessible form of government, I'd love to see that. Councillor Lukes, you say you want to listen to people before putting anything in on Wellington Crescent, but you have demonstrated that you can't even listen to almost 50 people who took the time out of their lives to be heard last week and demanded to remove the delay in implementing.
Excuse me.
Not accurate. I sat here
yeah.
and listened to every single word
I was
they
about to,
had to
I was
say.
about to.
May I finish? No. I have 5 minutes.
No, you don't, actually you don't. You have 5, excuse me. Excuse me, can you just cut the mic, please? Thank you. Your time has been paused. Your time has been paused. Okay. If you would like, excuse me. Okay, we're going to take a recess because there is decorum that we're going to hold to here, so thank you very much. We're taking a recess. Thank you. Thank you. We'll reconvene our meeting of Executive Policy Committee for July the 8th. I will state that whether individuals, delegates, or even councillors, members of council, members of the public, like what's being said or like the response of councillors or myself or not, at City Hall we do have this committee structure where we allow and invite members of the public to speak and give presentations, but it has to be done in such a way that we maintain decorum. So if the chair, whether it's myself or anyone else sitting in the chair, calls on a delegate to pause, wants to correct something, you can't ignore or reject what the chair is trying to do. There still has to be a measure of structure and process here. There is an institution at City Hall and a way of doing things. You don't have to agree with the chair, but you do have to respect the position and the role and the call of the chair. That's just the way it is in every government structure at every level. And so when people don't, when I'm in this chair, we'll shut it down. I'll shut it down every time if I have to. And we'll wait because we have a system that has been around for a lot of years. It's not perfect, but it's important that we maintain order and structure and respect in this chamber. So I want to thank everyone involved in maintaining order and respect. I will now go, Madam Speaker, to our next delegate.
Okay, next up is Marika Howell-Favell, joining us in person if they're here. With respect to item 4 of the report of the Standing Policy Committee on Public Works. And following Marika, we'll hear from Meg Sears, who's joining us via Zoom, and Maria Luisa Zachar.
Hello.
Good afternoon.
Good afternoon.
I go by M, and I am a motorist, a pedestrian, cyclist, so a vulnerable road user at times. Today I drove here because I live in Selkirk, but when I'm in the city and I work in the city, for the most part I've never worked in Selkirk, I commute to work via bicycle. Just today on my way to City Hall for the first time before the 1.5 hour lunch recess, I was crossing a street and a taxi driver decided to floor it in front of a wheelchair user who was crossing in a pedestrian crosswalk. And then on my way back here, because I had to move my car for parking, I went to the museum. On my way back here, I was crossing left, going through traffic, and another bunch of pedestrians were walking, and a car floored it to beat them across the crosswalk. So that's just a demonstration of how toxic and unthoughtful a lot of motorists are in the city, and how the lack of proper infrastructure, the bike lanes, are promoting a really bad motorist headspace, that they think that they can just do that. I've been honked at, yelled at, all these things while on the bike, exerting my rights, like, and following the rules, like I should be. So I want to say that I'm in opposition to the proposed timeline of this bike lane. If there was proper infrastructure in place, then Rob Jenner may have lived. He probably would have. So I think any delay of this project that was already told that it should have been done by now, this time like last year when it happened, is unacceptable, and it's a disappointment, and I'm personally disappointed. When I come here to listen to everybody else talk, I'm learning a lot too, and I'm sure everybody here is listening and learning a lot. And I'm hoping that when you hear these words that are coming from everybody's spirit and heart of general concern for the lives of people that every Winnipegger, everybody here is supposed to protect, I think it's disappointing when these changes aren't made. And I'd like to see a bike lane. I'd like to see the proper infrastructure, because where it stands right now, it's not safe. Everybody's coming here saying, I don't feel safe. And, I've heard people speak on this pilot about how it's not a typical way of doing things. And to me, I'm new to this, I'll admit, but I don't understand how you're supposed to get feedback from something that hasn't been done. So I'm urging everybody who can do things about this to maybe rethink that and put those who are vulnerable road users at the top of the priority, because the reason they're vulnerable is because they're at the bottom of this priority. We wouldn't be vulnerable road users if proper measures were in place to protect us. Now, like I said, I have 2 instances from today that I saw. That's just from today. That's just from driving for all of 15 minutes between the 2 things. I've seen a lot happen as a motorist, as a cyclist, as a pedestrian happening in Winnipeg. I could go on forever about them. I'm sure you've seen them too, and that's why I ask you guys to do something about it. So I will end my time. If there's anybody who has any questions.
Thank you. Are there any questions at all? Okay. Well, thank you for your presentation. Appreciate that. Thank you for waiting and being here after lunch. Thank you so much.
Thank you.
Okay, our next delegation is Meg Sears, joining us via Zoom with respect to item 5 of the Standing Policy Committee on Water and Waste and Environment. Meg, if you want to go ahead and unmute yourself, you have up to 5 minutes.
Thank you ever so much for this opportunity. I really appreciate that your committee is addressing this very important issue of electromagnetic sensitivities. So good afternoon, Mayor Gillingham and committee. I thank you for this opportunity to encourage you to utilize the best available technologies for human and environmental health as you shift your mechanisms, your technology to report water use. In lieu of manual reading, you're now going to have meters that will be connected. They could be connected with wireline for communications, but if that's not feasible, then there are a lot of strategies and technologies that may be optimized to use the bare minimum of wireless signals. Generally, we're pretty lackadaisical. Wireless is something which we do not optimize in terms of minimizing the actual signal. We use more bandwidth than we need a lot of the time. But given that your people are sensitive to this, then this is a good time to really optimize and minimize this this exposure. I myself, I'm a scientist. I authored a report called The Medical Perspectives on Environmental Sensitivities, and it was published by the Canadian Human Rights Commission back in 2007. And even at that time, I did include the topic of electromagnetic sensitivities because we're all shaped and affected by our life history, including our environmental exposures. And the radio frequency spectrum used for telecommunications is successful because historically there's near zero background in the natural environment. This is a type of exposure that all life on Earth has evolved in the absence of. So this is brand new to all life on Earth in the last, century. And some people are indeed exquisitely sensitive to this novel exposure. So as a medical scientist, I know that we understand how this occurs from the level of basic biochemistry, from cellular processes within the body, and the systemic effects that you have heard about today that are indeed disabling. I'd be quite happy to give you a science lesson, but that's not what you're here for today. But as a scientist, I can assure you that minimizing in every possible way this type of exposure, being a leader in the safest technologies, is something which is much needed, and I really look forward to Winnipeg taking this on as a challenge. So I'm happy to answer any questions.
Thank you so much for this. Ms. Sears, any questions at all? Councillor Eadie.
Thank you for your presentation. So just to make sure I understand what you're presenting, so you're acknowledging there's ways of minimizing wave strength and stuff like that?
Yes. Well, first of all, generally, these technologies are used to be within standards that are set by the federal government, but these standards are not science-based. They have not been revised and properly looked at for many decades, and there's good evidence from around the world that these standards are too lax. So,
but you're saying, though, that there could be less
absolutely, yes.
radio waves. Okay, I just wanted to confirm that because there's mention of that in this report about.
Yes, certainly, for instance, do you need to be sending information about the last hour's water use? Right, if there's somebody coming to the house, then maybe you get a complete report once a month. There's no need for constant vigilance over everybody's water use.
Right.
That kind of thing. And there are also technologies such as wireline to, we know about fiber cable and so on. So there are alternatives for transmission. And for people who are particularly sensitive, it's possible to, if you are going to have radio frequency used, perhaps you could put the transceiver at the edge of the property as opposed to, on the wall right outside a bedroom, just to give an example.
Okay, thank you.
Great. Thank you.
Thank you very much. Other questions at all? Okay, thank you very much for your time today.
Well, thank you very much for the opportunity. Good luck.
Thank you.
Okay, our next delegation is Maria Luisa Zakar, joining us in person, also with respect to the same item. And then following Maria Luisa, we'll hear from our last delegation, Samantha Biko.
Hello, welcome.
Hello, dear Mayor and dear members of the Executive Policy Committee. I am in support of today's recommendation 1, and I ask you to pass today's recommendation 1. But there is some unfinished business that I would like to speak to with you today, and it is regarding the opt-out program. As far as I know, there is no record that I could find of the Standing Policy Committee on Water, Waste and Environment, voting in favor or in opposition to the recommendation the staff made that is described in the June 27th staff report. The recommendation is on page 6, and it states that the city not implement an opt-out program for the advanced metering system in order to maximize the full benefits of the technology. So this is just a recommendation. In other words, the opt-out program has not been officially decided on, and it's still on the table. And we need to have a fully developed proposal for an opt-out program produced by the staff, because there aren't enough details in the staff report to even comment on, and for councillors to actually make decisions on this program. On page 12 of the staff report, it states, that the details of the opt-out program will not be known until the water meter and related technology specifications are selected through the procurement process. And the selection and the award of the meter related technology is expected in the first quarter of 2026. So we need to know in detail what other cities are doing, and need to be upon which we can make informed decisions, because we so far do not have the information to make good decisions about this program. And we need to review and select the best features that the other cities have in place and add to them based on our city's own needs. And these cities are listed on page 11 of the report, right here. And they are Toronto, Halifax, Edmonton, Saskatoon, Penticton, Kelowna, and Kamloops. So whether there will be an opt-out program has not been decided, as far as I can find the information. And what I do ask you is to do what is in your power to do to get a fully developed opt-out program created so that councillors can make an informed decision about this important matter that is affecting all Winnipeggers. Thank you so much for your time.
Thank you. Any questions at all? Councillor Eadie.
I was hoping, I guess it's, so the recommendation that came out of Water, Waste and Environment is basically, what we're saying is we're acknowledging that we have to accommodate persons who have a disability as described by a doctor, whatever, with the radio wave transmission. The opt-out program that they listed in there with options, the public service did look in some detail at some of those cities and their opt-out programs and what they do. And actually, one city is removing their opt-out program completely. What the motion at Water, Waste and Environment is there's no opt-out program, but if you have a proven disability as a result of those radio waves, then they will accommodate in various ways. And if there are some people who don't have a doctor's, whatever, but there are ways, and we heard just from the previous presenter, that there are ways to minimize, if not cancel out any exposure on a transmission or how often and that sort of thing. So we decided not to have an opt-out program, but to acknowledge that we have to accommodate persons with disabilities.
Okay, I am aware of that. Thank you for reviewing that.
After we're done today, there won't be a presentation of an opt-out program because there's not going to be one.
And where is it in public record that this decision has been made?
It was in the recommendation.
But it's just the recommendation.
The original recommendation was not to establish an opt-out program. We amended the recommendation to acknowledge there are persons with disabilities who need to be accommodated, and it leaves the opt-out program as just information that they provided us. So when we vote today on recommendation 1, it will be when the program does move ahead and they contact each homeowner, if there's somebody there who has a disability because of that, then they're going to look at ways, but there will be a smart meter installed because it accurately measures the water usage better than the analog system. And we are not using the analog software system anywhere.
So,
after.
so
anyway,
thank you, Councillor. It was supposed to be kind of a question and answer point of view, but anyways. Any other questions at all at this point? Okay, thank you very much for your presentation today. Thank you.
Okay, our last delegation is Samantha Biko, to be heard in opposition to item 4 of the Standing Policy Committee on Public Works. And Samantha's joining us via Zoom. You have 5 minutes.
Oh, sorry, Samantha, your microphone's not on yet. I don't think. We can't hear you. Try again, please.
I can see that your audio is connected and you're not muted, so just perhaps there's a connection error on your end?
Is it our end? Try again. Let's try speaking again, Samantha. Oh, there, it's coming now. Just at the end there, it was coming. Oh, now we can't hear you again. It was there for a moment.
Can you hear me now?
There we go. You're there. Thank you very much. Go ahead.
Thank you. I appreciate this is a long day. Good afternoon, councillors, Mayor Gillingham. Thank you for hearing me today as the final delegation to speak about the Wellington Bike Lane pilot. For context about me, I have been cycle commuting from my lifelong neighborhood of Charleswood to my office in the Exchange District for over 10 years. I live in a 2-car household and characterize myself as a reluctant driver or a multimodal road user. On July 3rd, I also sat in the gallery for 7 hours hearing delegates speak about the unnecessary delay alongside committee members. I hear the frustration still carrying over from that meeting from both sides of the aisle. It was said today that bike lanes are polarizing and that there is concern from the blowback of vehicle owners if the project was implemented. I do imagine it's because the evidence is undeniable that motor-normative behavior leads to violent, life-threatening actions by those behind the wheel, and engaging with those folks might stress council out. Big same. I engage with them every day, but luckily I'm still here to speak about it. Yes, bike lanes are polarizing, but they are also the key to unlocking many of the goals you've laid out in the Transportation Master Plan, a guideline for the progressive city you and many of us envision. I believe we can work together on this if a mutual empathy for vulnerable road users could align with council's decision-making. It was also said today 9 votes are needed to get this going, and this is my invitation for you to activate us, the folks coming to these meetings at the end of their emotional tethers, repeatedly taking time out of their lives to champion this project. Tensions are high because we care about this project and what it means for everyone interacting with bike lanes, motorists and cyclists alike. Despite what might be interpreted as volatility, we can help you get those votes. We are your pro bono consultants with literal skin in the game, and we still have hope that our words and stories can drive the change we both wish to see here. Since this proposal entered public record last June after Rob Jenner's death, it's safe to say we're all pickled in cortisol from having to continue to speak about this. Excavating our road traumas, getting hopeful and energized by engaging in the public process, and repeatedly being told these traumas aren't convincing enough to make the change. Yes, that makes folks experience a less than favorable human response, as you've seen today. Many of us have tried politely asking. We've tried showing you the Gorilla Bike Lane on June 6th. Activists did a die-in at City Hall last week. But the results of these efforts are quickly forgotten, as quickly as a cyclist is struck in a hit and run. When I first started cycling as a tween 25 years ago, it was because I couldn't drive, and I was trapped in my suburban Charleswood home, which was consumed by domestic violence. Cycling was my primary means of escape, and living in that environment as an unwilling bystander gives you the following headspace. If only I could say the right thing, the violence will stop. Delegates speaking to this are in that headspace right now, every day, which is why we continue to engage with you on this. At this point, we're not sure what the right words in the right order are to escape this particular cycle of violence. Community is begging for this bike lane. You have months of our words on public record as to why you should move ahead. You've had to sit through hours of us offering up our worst experiences on the roads you won't adapt, and you've had to witness us at our emotional worst to demonstrate what this costs us. The prevalent opinion is that active transportation advocates like us are a nuisance, akin to cockroaches, according to a new Australian study. I'd say that the humble cockroach at least can survive in the worst conditions, as cyclists have in this city for decades. But unfortunately, even a cockroach is no match for a driver that already hates us and a society that tells them it's acceptable to do so. So please remove the delay on installing the proposed Wellington bike pilot. Take into account the feedback already provided by your citizenry today and meetings prior. This is an easy win for all of us, and I hope a way forward to the brighter Winnipeg I know this committee desires. Thank you.
Thank you. Any questions at all? Okay, thank you very much for your time today and for your patience in waiting to get on today. Thank you so much.
Thank you.
All right, I believe that's the end of our delegations.
Correct. That concludes the delegations for today.
Thank you. All right, moving then into our agenda items. Item number 1 is the monthly update on supportive housing, addiction, and social action indicators. Mr. Interim CAO.
Yes, item number 1, Alicia Rappaport, manager of the Housing Accelerator Fund. Can you join me?
Good afternoon, Ms. Rappaport. Thank you so much for being here.
Good afternoon, everyone. I'll be brief on the first report here. It's our regular monthly report on housing statistics. Things are moving along fine, I would say. We're not exactly where I would maybe hope. Last month, we were halfway through the year. We were just under, I think we were at 48% of our units, and we haven't increased that much in the last month, so we're continuing to monitor. I'm not worried yet, as we're continuing to monitor all the projects we've supported under our HAF grants round 1, which require a building permit by September. 2 out of 10 which have already been received, which is great, and we're continuing to monitor progress. So no concerns as of yet. I just want to make one note on the report. There's a typo on page 3. Under table 3, the note identifies that 1 new project has been approved for pre-development support. It identifies it's 100 units, but it is actually 110 units, and the breakdown is correct. 60 market units, 20 at 80% below median market rent, and 30 at 60% median market rent. So it's actually 110, and the numbers in the chart are correct.
Right.
That's it.
Okay, any questions at all? Okay, Councilor Lukes.
Sorry. So I just wanted to ask you this. I have a project, 2 projects that are Manitoba Housing Projects. CMHC is funding them, and the developers are ready to go. They're told they can't make the subdivision rezoning public hearing till October. So I don't know. They're supposed to be on the fast track with Mahi and that crowd. So is that's not fast.
Yeah, I am aware of the projects. They are receiving our concierge support because they do meet our affordable housing requirements. But that's the deadlines that we're receiving and up against from land development at this stage. They're booking into October hearings, not September.
From who?
From land development through the planning, property, and development department.
So they're ready to go, but now they have to wait till October. So that, that's the accelerated program?
Yes.
Yeah. Okay.
They receive early comments through all departments at each stage, so that they won't receive the same number of roadblocks once they're in the queue. So that's what we do to accelerate it. But yeah, there is a bit of a delay right now to get to a public hearing, part of which is the August prorogue. So, we lose a month there when council doesn't meet, so they're into the following cycle.
Right. We thought we could get them on September, but now it's October. Okay. Okay.
Any other questions at all? Okay, thank you. Motion then, Councillor Duncan.
I'll move to receive the report as information.
All in favor? Aye. Aye. Opposed? Carried. Item 2, Housing Accelerator Fund Grant Program Bylaw Amendments. They are before us here. Any questions at all for Ms. Rappaport on the amendments being proposed here to the bylaw? Okay.
I'll move the Winnipeg Public Service recommendation on item number 2.
All those in favor? Aye.
Aye.
Opposed? Carried. Thank you very much. Appreciate that. Item 3 is the annual report, Communities Fund Expenditures.
Yeah, okay, so they want an extension of 60 days, so I'll bring that forward, the recommendation from the public service. Make a
All in
motion.
favor? Aye.
Aye.
Opposed? Carried. Thank you. Item 4 is the 2024 Councilors Ward Allowance CWA Audit. Councilor Lukes, would you move
Yep.
that item as
All
well,
right.
please?
Yes, one of them was mine, everything's good, so. All right, whoops, sorry about that. All right, so I'd like to bring forward the recommendation from the public service then, which, I don't know,
Okay.
just receive it as
Receive as info.
information.
All those in favor? Aye.
Aye.
Opposed? Carried. Thank you. Item number 5 is results of May 13, 2025 advertisement of proposed asphaltic concrete lane pavement local improvement projects numbers, a long number, and another long number.
Yeah.
So, go ahead.
So I'll bring this one forward, that the recommendation of the public service, that the local improvements proceed as part of the program.
All those in favor? Aye.
Aye.
Opposed? Carried. Thank you. Item 6 is the progress of the proactive cleanup of dangerous debris interim verbal report. Mr. CAO, interim CAO?
Yes, I have Jim Berezowski, Director of Public Works, who's on his way down to give an update and answer any questions.
Okay, thank you very much, Mr. Berezowski, for being here. We'll let you provide an update of the dangerous debris cleanup.
Yep, thank you, Mr. Mayor. Good afternoon, committee. Since our May update, which we last identified, we had collected 944 needles in those 16 identified parks and 185 in other. To this committee meeting date, we've since collected a total of 2,573 in those 16 identified parks. The interesting part is that we've, as well in the proactive areas, we've identified an additional 456 needles collected, and that's kind of like where our gardeners and litter collection people are frequently going through. And then a little bit of an alarming one is an additional 791 collected in various areas throughout the city. Areas like Jacob Penner Park, across the Tecumseh bus stop, areas around the hospital, places like that. We've collected a few hundred there alone. So that's something that wasn't in the original plans, but is part of our response process. So since the spring melt, the needle pickups actually, in a way, have decreased because we had that original blitz. But what we're finding is that the majority of the needles that were found are in areas adjacent to existing encampments. And we're finding more needles at those incidental sites than the original 16 sites that were identified as a major cause of concern. So we're continuing on and working through the summer here, but we're seeing that trend spread out a little bit more than we anticipated.
Thank you. You probably won't know this, but I know that it just prompted me. We need to follow up with our clerks, I think. Part of our budget process was to require agencies that distribute needles we're asking the province that those agencies also be required to implement some sort of collection mechanism as well. I know as is the process, the clerks would have sent that letter to the province. I haven't got an update recently, but I've just made a note to myself to follow up on that. Unless you, Mr. Berezowski, have any information on that?
We have not received the official response from the province as of yet.
Okay, I just made a note for my office to follow up with clerks to find out where that's at. Thank you. Any other questions related to this? Thanks for the good work. We do appreciate it. Thank you very much.
Thank you.
Okay, Councillor Santos, would you move receipt of this verbal report, please?
I will move receipt of the interim verbal report.
All those in favor, aye.
Aye.
Opposed? Carried. Thank you. Item 7, bylaw enforcement strategy.
Well, this is good. This is a very in-depth report. I'm happy to see it. It's been a long time coming. I don't know if there's any questions or anything, but if not, I'll move the bylaw enforcement strategy so that we can start on phase 1.
Some good steps here, really important. We've, as a council, been calling for, as part of our strategic plan that we put together just after we were elected in this term. This is one of the items on that strategic plan, to look at the kind of consolidation and bringing the bylaw enforcement together with a strategy. Here we have the first step. So all those in favor, aye.
Aye.
Opposed? Carried. Thank you. Item number 8 is Winnipeg Civic Employees Benefits Program amendments to the pension plan. Before we vote on this, I do want to recognize the presence of Sheldon Angus, for the CEO of the Winnipeg Civic Employees Benefit Program, who's in the audience today. So thank you so much for being here. We do appreciate your presence today. Thank you. Any questions at all for Mr. Angus or for our CFO, Tracy Graham? No? Okay. Councillor Lukes, would you move this item, please, then?
So, right, so our approval is required to reflect changes in the trust agreement, so there's no financial implications. So I'll move the public services recommendations.
Okay, 2 recommendations there. All in favor? Aye.
Aye.
Opposed? Carried. Thank you so much. Item number 9 is the contribution towards repairs to areaways and streetscaping for Waiwane Bagekanagan development located at 450 Portage Avenue, the former Hudson's Bay building. Councillor Lukes, would you move this item, please? Item number 9.
Item number 9 is, well, I think it's very exciting, right? This is progressing. Streetscaping, downtown is just, it's just coming alive. So I'll move this report, the public services recommendations.
Thank you, and I do recognize as well and thank Grand Chief Jerry Daniels for his submission which accompanies this report. All those in favor, aye.
Aye.
Opposed? Carried. Thank you. Item number 10 is the approval of 5-year contract extension for supply, installation, and operation of photo enforcement program, RFP proposal 576-2012. Councillor Santos, please.
Yeah, so thank you. Just supporting the Winnipeg Public Service recommendation to deliver an extension of contract for the installation and operation of a photo enforcement program for a period of September 1st, 2025 to August 31st, 2030.
Okay, thank you. That is the motion. All in favor?
Aye.
Aye. Opposed? Carried. Thank you. Item 11 is Welcome Winnipeg Policy Review. I think they're asking for a 90-day extension, Madam Clerk. Councillor Santos, do you mind moving that 90-day extension?
I'll move the public service request for an extension of up to 90 days be granted.
All those in favor, aye.
Aye.
Opposed? Carried. Thank you. Item 12 is the landfill search operations motion. Councillor Duncan.
Thank you very much. Appreciate Councillor Gilroy coming to speak in a delegation this morning. I agree with her stance on many of these things. I think that we need to work more with the public service and Winnipeg Police to make sure that we're doing everything we can in the case of any future tragedies. However, I'm not sure how we would go about moving on this particular motion today, and I'd be moving to receive it as information at this point in time.
Thank you. Now, I do appreciate the Councillor Gilroy's, like you have said, I appreciate Councillor Gilroy's motion submission. I think it's important to first take the next steps when it comes to the Brady Road search, which we'll hear about in the coming weeks or months. Hopefully not too long from now. And once, I think we'll have a better sense of what could be reviewed after that. So I'll support receiving his information at this time. All those in favor of receiving his information, aye. Aye. Opposed? Okay, thank you. Recorded in opposition, Councillor Santos. Appreciate that. Item number 13, General Council, Winnipeg Community Centres, Plan 2045. Councillor Santos.
Yes. Just want to quickly acknowledge Laura Messman and the department for all the great work that they've done to develop, basically the next 25 years for the General Council, the GCWCC plan. Want to also thank the community centers and all the volunteers who put all the time and effort to do the stakeholder engagement and really put some thought into what are the next steps that we could do to really, hone in on the programming, especially the governance model that really needs to do a better job. We're seeing, a decrease in our volunteers all across the city, and that's no fault of anybody, but it's a lot of hard work for volunteers to do such great things in the community. I don't want to belabor the issue, but I think what we've got is a lay of the land of something that's going to be renewing what's in the city of Winnipeg. And we've got a couple of recommendations here, specifically, the funding in the amount of $250,000 annually to begin next year to kind of help with that grant programming and the ability for community centers to hire operational programming staff, which supports transitioning from boards to a governance board model. And then also an increase to the operating grant in the amount of $35,000 to retain external legal advice to support community centers during the development and execution of management agreements between the City of Winnipeg and each community center. So there's a lot of work that needs to be done. This is just the first part of many steps that need to occur in a couple of years. I can hear from my council colleagues there's still some issues that's not quite laid out in the plan, but I think if we can just have this first step, continue ongoing dialogue with other councillors, I think we can really have a great way of bringing community centers together. So I don't want to take too much time, but I'll move the Winnipeg Public Service recommendation.
Thank you, Councillor Santos. Councillor Lukes.
I'll just add some comments that I want to put on the record. I want to thank Laura Messman and her team for doing all this work. It was a lot of work for 2 years. Consulting with community is always engaging, interesting, exhausting, all of that. I get a lot of feedback from people very, very, very disturbed that Southwest Winnipeg is getting a new rec campus. I know many people don't travel out there. They don't realize its population is larger than Brandon, and that there is not one single place that we really have to use other than one building, I guess, built in the probably 70s. So I don't know, I'll support this now. I don't know what I'll do at council. We've got all these facilities, 80-plus facilities, and we have this massive deficit. And I guess we're just going to keep band-aiding them up. I was sort of expecting a big, rigorous plan, but again, it is rigorous. But for me, I know councillors are part of the problem too. They don't want to close down. Some are keen on amalgamating, others aren't. I understand all that, but it's just it's impossible to keep these things running. It's impossible to keep the facilities up to a modern recreational standard. I see what happens at Dakota and how it's so heavily used by people outside the catchment because it's got state-of-the-art facilities. When the one in Southwest Winnipeg opens, we'll have state-of-the-art facilities also, and people will be flocking to that one and not using their decrepit old ones that are crumbling that no one wants to shut down for whatever reason. So I guess basically council is half the blame too on all of this, but I'll support it now and we'll see what happens. I just really think we need a big overhaul, and I thought this was going to be the big overhaul, but it's a step in the direction, and like Councillor Santos says, there's a lot of work to do, so on both sides of the table. So I'll support it.
Thank you very much. Any other comments? Okay, seeing none, then all in favor? Aye. Opposed? Carried. Thank you. Councillor Duncan, are you willing to move items 14 through 21 conclusive?
I would be willing to do that, items 14 through 21, I believe.
All in favor? Aye. Aye. Opposed? Carried. Thank you very much. Item 22 is Land Dedication Reserve, Knights of Roselle, Winnipeg Chapter Historical Marker. I wonder, Councillor Santos, if you're willing to
Thank you,
take this one,
Mr. Mayor. I would be very happy and honored to move the Land Dedication Reserve Fund for the Knights of Roselle Winnipeg Chapter to provide a $10,000 land dedication from the Point Douglas ward. It's coming here because I believe it doesn't quite meet criteria, and it needs to go all the way up to council. So hopefully EPC members can support me as we move forward with this project.
All in favor? Aye.
Aye.
Opposed? Carried. Thank you. One item from the Audit Committee, 2024 Mayor's Office, Chairperson Expenditures, Audit Findings and Expenditure Report. The report of the Audit Committee is there before us. Councillor Lukes, would you move this item, please?
This was one I used to love to dive into. All right, I'll make a motion to move this on
All in
behalf
favor?
of the Governance
Aye.
Committee. Aye.
Opposed? Carried. Thank you. Moving on to the report of Standing Policy Committee on Water, Waste and the Environment dated June 27th, 2025. Perhaps we move the first four items, Councillor.
Yeah, I'm going to do that. And then I have an amendment for report item number 5.
Okay, so moving items 1 to 4 then. Councillor Eady moves 1 to 4. All in favor? Aye.
Aye.
Opposed? Carried.
Yeah,
Thank you.
and
Item
so
5.
on report number 5, Mr. Mayor, I have a slight amendment, and I'm going to get our clerk to read it. I believe she has the motion, but we're just listening to the delegations. It sounds as if finding doctors qualified to look at this type of ill effects that some people are getting from radio waves. I'm going to amend it so that it would be a doctor who's registered with any other provincial or territorial regulating body.
Would you like me to read it out, Councillor Eady?
Pardon me?
Would you like me to read out the amendment?
Yeah, could you?
Sure. So in recommendation 1, we're deleting the words registered with the College of Physicians and Surgeons of Manitoba and replacing with registered with the appropriate provincial or territorial regulatory authority within Canada.
Yeah. And it'll still have if you're already registered for the disability tax credit, which you need to be substantially disabled in order to utilize that credit. That's also there. Mr. Mayor, this as I explained to one of the delegations, this means that there won't be any opt-out program developed moving into the future. This is about accommodating people who are experiencing ill effects from the radio waves. So moved.
Okay, any discussion on the matter? Okay, I'll call the question on this item then as amended. All in favor?
Aye.
Opposed? Nay? Okay, so
I'll take a nay on that too, sorry.
a nay? Okay. So I believe the motion is lost then. 4 to 2? 2 to 4?
I think it was
Think so?
3-3.
Okay.
So amendment
Those
fails.
in
Amendment
favor,
fails.
those in favor, please raise your hands. Those opposed, raise your hands.
Oh, sorry, Councillor.
Okay, the item is lost then. Okay. Councillor.
I'll move the amendment recommendation.
So Councillor Parwadi, welcome back, is moving the original recommendation then, the administration's recommendation?
To revert back.
Okay.
Really?
All in favor of that then? Aye?
Aye.
Opposed?
Nay.
Nay, okay.
Don't like people with disabilities, I guess.
Okay, moving on then to the next item. St. Paul's Committee on Community Services dated July 2nd, 2025. Maybe, Councillor Santos, I think you have an amending motion on 1, right? So can we move 2 to 4
Yes.
to start with?
Yes, I will move items 2, 3, and 4. Consent agenda item, is that how we say it? I don't know.
All in favor? Aye.
Okay.
Opposed? Carried. Item number 1 has an amendment.
Yes, so just going to get my notes here. I want to thank Councillor Lukes, as well as the department, Dave Domke and Jim Berezowski, for working with me on creating this amendment. I think the challenge that we're faced here is cricket, even though it's kind of newer to Winnipeg, but it's been around for, 100 years. I think we had one of the delegates come out and speak that cricket in Manitoba actually started back in 1894, which was quite interesting. Bit of history. And their hours are different than soccer and baseball. And so we want to be able to come to a bit of a middle ground. So back at committee, we didn't accept the recommendations of the public service, and we wanted to receive it as information. But I've had some time to work with Councillor Lukes and the Cricket Association to understand a little bit more of some of the dynamics of cricket. So my new recommendation here is that the public service be directed to that we delete recommendation 1 and replace it with that the public service be directed to work with the Manitoba Cricket Association on the creation of half booking time slots that reflect the longer duration of cricket games specific to the Bridgewater Lakes Parks and report back in 90 days. And then, of course, the second recommendation is that the proper officers of the City of Winnipeg be authorized to do all things necessary. I think right now what we're dealing with is because our booking blocks is 4 hours in the morning, 9 to 1, 5 hours in the afternoon, 1 to 6, and then the last booking block is 6 o'clock and on. I think there is an opportunity here to see if we can create more of a half booking time slot. Remember that language is important, that we can take the afternoon hours such as 1 to 6 p.m. and only book half of that. So I think that can provide a bit of a balanced approach, and I hope the public service can work with Manitoba Cricket Association on creating something like that, just specifically only for Bridgewater Lakes Parks, because it's the only cricket pitch that is available in the entire City of Winnipeg. We're not looking at any other fields that are out there. It's only this particular park. And then, down the road in the future, when more cricket pitches come online, I know I'm looking for one in my particular area and ward. Maybe there's an opportunity to expand or re-look at this. But I think for now, this is kind of provides a bit of a balanced approach on what the association's looking for and to kind of mitigate some of the fees that are being imposed on them. So hopefully EPC can support that.
Thank you. Appreciate your work on that. Any other questions on that? Okay, then the motion is moved as amended. All in favor, aye.
Aye.
Opposed, carried. Thank you. Moving on then to the next report, and that is the report of the St. Paul's Committee on Public Works dated July 3rd, 2025. 4 items on the agenda. Councillor Lukes.
So we've spoke a lot in detail on all these 4 items at various committees and Finance Committee also. And in the media, I'd like to move consent agenda of items 1 through 4.
Okay. All those in favor, aye. Councillor Duncan. Record in opposition, number 4. Okay. Okay. Report Standing Policy Committee on Property and Development dated July 4th, 2025. There are 16 items. I think item 11 has an amendment. I'm going to pull item 2.
Yes.
And pull 11.
Suggest that we discuss item 2 if we have member of the public service available to give us.
First of all then, Councillor Duncan, are you moving 1, 3, 4, 5, 6, 7, 8, 9, 10, 12 through to 16?
Unless Mr. Armbruster has somebody from Property and Development to speak to number 12, which is a very exciting approval for the Canada Lands portion of the Naue Odina first phase development. Not sure that anybody's here, but
Yeah, don't,
significant development.
yeah, I could take away any questions or follow up.
That's all right. I'll move as noted by the mayor and with the exclusion of those 2 items.
Okay, all items except 2 and 11. All those in favor, aye.
Aye.
Opposed, carried. Thank you. Item number 2, do you want to introduce that one, please, Councillor Duncan?
Yes, absolutely. So this is the award of the contract for the City Archives building redevelopment at 380 William Avenue. I actually took an interest in this along with the mayor leading this as a significant project. And I took more of an interest in this due to the grave circumstances that the current housing facility is for the archives. You know, I won't get into details of what risk lies there should we not invest into a redevelopment of a secure facility that the public can come and visit. But this is extremely important that we do this to preserve our city's rich history and the not only the cities, but the rural municipalities that have made up Unicity for over 100 years. So if the public service has an overview, I see we have our clerk here, but I'll pass it over to our CAO.
Yes, thank you, Mr. Chair. I think Carlos Gamero, City Clerk, is here to...
Let's give our clerk a moment to come down. Thank you, Mr. Clerk. Yes, if there's any, do you have any questions specific, or do you want our clerk just to provide some highlights related to the latest on the archives building redevelopment?
Just an overview of the project itself.
Maybe just kind of where things are at. I know that we're dealing with here is an increase to budget, but as Councillor Duncan has rightly pointed out, it's a very critical project. We really are not treating our archives as they should be treated at this point for preservation. Councillor Duncan, why don't you go ahead and then I'll turn it back to the clerk.
My apologies for interjecting, Mr. Mayor. I think one of the most important parts here, and if our city clerk could speak to it, it was brought up at P&D around public accessibility to the 380 William site and how important that will be for Winnipeggers to engage and explore Winnipeg's history.
So one of the functions of the redevelopments is just to do that. It's just to increase public accessibility to the building. Part of the project includes a multi-purpose room, which would be available for lecture series and for other educational purposes. There's also an increased or enhanced aspect to the research capabilities as well. There were limited resources and space available for researchers to come to the previous building, certainly in the existing building, and this will enhance all of that.
Okay. Thank you. I do note, I think, last year, as part of our Winnipeg 150 celebrations, we were doing some digging into the city's history. And if I've got this right, I'm pretty sure I do, one of the very first items, the clerk asked the council to purchase back in the first 2 months of the city of Winnipeg existing was basically a little cupboard, a little container to hold on to the record books of the city of Winnipeg. So correct. Basically the first asset the city of Winnipeg owned was kind of a storage space for city records. And so we do have a lot of work to do. I really appreciate the support of Winnipeg City Council on this investment. It is, a budget, unfortunately, that has grown, but it's a critical investment. This, to me, is one of those investments that is really about the future of our city and future generations. And so really look forward to this archives project, building project being done ultimately. So with that then, Councillor Eadie, go ahead.
The historic I do believe this building is the original first Carnegie Library for the city of Winnipeg as well.
Correct.
So, I mean, we're preserving our heritage in a heritage building, and it's exciting. And heritage buildings always cost more to renovate. So,
thank you so much. Okay, all those in favor then? Aye.
Aye.
Opposed? Carried. Thank you. Moving on to item number 11, and there's an amending motion, I think, to this subdivision rezoning at 750 Bonner Avenue, DASZ 11/2025. I thank Councillor Bawadi and Councillor Duncan for working together on the amending motion.
Thank you, Mr. Mayor. Following the debate that happened at Property and Development, and strictly that with the public service, it was pointed out that the zoning agreement that was proposed would apply to both the original house fronting Bonner Avenue as well as the new lot created on John Haida. The intention really was to place the restrictions specifically and only on the John Haida property. And having listened to that debate and the concerns from the public service, the revised 2AI clause will read as follows: that a maximum of one dwelling unit be permitted on Lot 2, created under DAS said 11/2025. That's what was requested from the neighborhood, from a large number of residents. And again, being one of only 3 lots in the whole subdivision that are undeveloped, I think this keeps that consistent, but does not remove any rights from the home fronting Bonner Avenue. Again, 77 feet on a chip sealed road, so that could be replaced with a duplex. If the road were to be paved, it would be a fourplex would be allowed.
Okay, thank you. Councillor Duncan?
Yeah, I just want to thank Councillor Prawadi for this. He brought it to my attention, and to make this slight amendment makes sense, especially with our current policies around infill and not hampering that potential infill in the future on Bonner.
I'll call the question on the item as amended. All those in favor, aye. Aye. Opposed? Carried. Thank you. Councillor Santos, would you move consent agenda and adjournment?
I will move consent agenda and adjournment at 2:56 PM.
All in favor, aye.
Aye.
Opposed? Thank you. Thank you to everyone involved in today's meeting. We are adjourned.